I'm live here. Oh, you know what? That's like the worst case scenario. It's like, what on earth triggered that? Now I'm going to try to start the Zoom meeting again. Let's figure this out. That's ridiculous. Yes. Okay. Zoom meeting. Zoom meeting. Hello, April. Hello, Sarah. I'm so sorry. That is what happens. Sometimes things just break down. I know. It's just a worst case scenario. I know. As newly diagnosed. Tamara, welcome. Welcome, 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 my friend. You are absolutely not alone. And I know Karen said something. Karen, right before everything, I don't know what happened here, but something happened here and my internet completely crashed. And that's why things broke down. I know Karen said something about how when she has intense pain, it shoots down her legs and her legs move. And that makes sense. Stephanie's back, Tamara's back. All right. So, so I had to start up a brand new stream. So I just got to do my intro again. Hello, everybody. My name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I'm the nation's longest serving IC support group leader. I've been a support group leader for 27 years. We are simulcasting live on Facebook and YouTube and Zoom, 3 places right now. And this is one of our normally scheduled meetings. I try to do meetings every Sunday. I could not do it last Sunday because I hurt my back, but it is what it is. So we were already broadcasting for 2 hours when the internet went to bits. I've restarted everything up. We are now moving into our Zoom meeting. This allows patients to tell their stories. And so let's go ahead. I'm going to post invites. Hold on. I see Sarah. Hi, Sarah.
Hi, Jill.
All right, so hold on one sec. Let me just copy this invitation again. So for everybody on Facebook, I'm putting the invite in. On YouTube, we lost almost everybody, but for those of you on YouTube, I'm sorry, the internet crashed.
It kicked out people.
All right. So for those of you on YouTube, we lost half of our people. But anyway, it's okay. We'll be back. Oh, Heidi says it wasn't me. It was something else. Okay, Sally says having a cysto, doctor doesn't think it's IC, but recurring infection. So Sally, in that case, having a next generation urine test would be the most important thing for you to do. Next generation urine test, because this will identify every living thing, every living bacteria and fungus in your urine. And so bladderhealth.org, it's a next generation urine test. Angie said, I commented earlier that I've been missing support groups today, working on Sunday. Have missed you. Oh, Angie, I miss you too. Guys,
what about
hold on. I can hear somebody. I have to mute somebody. Hold on. Hello, Heidi. Hello, Dawn. Let me just go ahead and mute April. And mute Sarah and okay. So, I'm not lying here, guys. I am not lying here. The best people in my life are you guys. The best people in my life are the other people who have IC who have struggled like I have struggled. And even though I'm better, and some of you are better and some of you are worse, and we go through good times and bad times, the gift of your friendship is nothing short of astonishing. And I want you to think of me as somebody who really cares about you. I'm a support group leader for a reason. If you were here in my town, the deal that I made with everybody in my support group is if you're in the hospital for any reason, I will be there with you if I can be, which is why I once did a 1-week stint in the ICU with an IC patient. I want you to know you're not alone. I want you to know that you're not damaged goods. I want you to know that this is not your fault. You have done nothing wrong. There is no shame. There is no blame in having pain. None. Zero, zip, nada. And anybody who gives you that crap can just go to hell. I'm sorry. You're suffering. You're suffering and you're injured. And we want to try to get you through to the other side. We want to try to understand what the injury is, get the right therapies for you so that you can get better like I have gotten better. Remember, I had one doctor tell me, you will forever be a burden on your family. You will always live with severe pain. I was 33 years old. The bastard, how dare he say that to me? But you know what? You know what? Here's the deal. I needed that. As cruel as that was, and believe me, some doctors can be very cruel, just like family members can be very cruel. That's what woke me up. And it was at that moment that I went, wait a second. I have 3 freaking college degrees. How dare you say that to me? I will prove you wrong, you son of a bitch, which is exactly what I said to him. Started my first support group 3 months later from my bed because I could barely walk. The pain was so bad. 9 months later, we did our first IC conference. And I got to speak to 200 people there. And I am living proof that you can get better because guess what? I haven't had that pain in a decade because he was wrong. It was not a bladder problem for me. It was a freaking pelvic floor problem for me. No wonder bladder therapies didn't work. No wonder bladder therapies didn't work. And so you are an anatomical mystery to be solved, my friends. You are an anatomical mystery to be solved. We got to understand your pelvis. We have to understand your body. You could be that person who started birth control and a week or 2 weeks later, you had issues because your hormones got screwed up. Or you could be that person who fell on your tailbone and you don't even remember the freaking fall. But from that moment on, you had frequency urgency. You've been on bladder therapies for a decade. They've never worked. Why? Because the fundamental problem might not be your bladder. But for some of you, it could be your bladder. Some of you might have taken medicine that irritated your bladder, like chemotherapy. Chemotherapy is called chemocystitis. It's real. It hurts. Chemicals damage the bladder wall. If you have a junky diet, guess what? It hurts. Seriously. Seriously, if you're drinking Mountain Dew, or any diet stuff, anything at all like that, listen, your body was not designed for high levels of acid. Your body was designed for life 1 million years ago, before they had soda. The only acid they had was in unripe fruit. And that was only once a year. Hi, Abdella. Hi, Savannah says she healed her IC 90% in months. Right? Okay. So anyway, listen. So this is what we're going to do. Lindsay says, pelvic floor balances irritate the heck out of my IC. My chronic regional pain syndrome stopped my ability to relieve myself many times. Your legs turn purple and severe pain. And Lindsay, I just saw an announcement last night about a whole new research network for chronic regional pain syndrome. And I actually copied down the guys who are leading it. And that was very interesting. Shirley says, you've got autoimmune IC with Hunter's lesions. And remember, Shirley, it's not necessarily autoimmune. For some people, it's viral infection. Hunter's lesions are viral infection. So this is what we're going to do. We're going to switch over to Zoom. So for those of you on Facebook and YouTube, you're going to hear the people talking on Zoom. I'm going to put the invites in one more time. If you want to come and join us over in the Zoom meeting, we'll be over here in the Zoom meeting for as long as necessary. And then we'll come back and do your Facebook questions and your YouTube questions. I am not ignoring you. All right, Zoom. Hello, my friends. Hello. How are you? I see, because I can see Heidi, and because my middle name happens to be Heidi, I'm going to go to Heidi first. So Heidi, let me unmute you. Hey, girl, how you doing? How is life? You're laying in bed. I don't know if I'm liking that or not. What's going on?
I'm having emergency surgery on Tuesday.
What? You had it or you're going to have it?
Going to have it.
Oh my, can I swear? What's going on? What's going on? Oh my God, honey, tell me.
And today's my birthday.
Oh no. Oh, big giant.
It's been horrible.
Oh, so what kind of surgery are you having?
I'm not allowed to say it per Dr. Peters.
Okay.
It's
okay. You can, if you don't have to say
I'm
it.
having something removed, but that's all I can say.
Okay.
I'll talk to you later privately about it.
Yeah. Would you, I mean, after the meeting, if it's possible, or call me tomorrow. So you're having it on Tuesday? Oh,
Yeah.
honey.
I'm in so much pain.
Can you hear me? Can you feel me hugging you right now? Oh,
Yeah,
I'm so sorry.
I do.
I'm so
He
sorry.
actually put me on a steroid to calm things down.
Okay. Okay.
I'm on doxycycline for embedded infection.
Okay. Okay.
2 that he
Okay.
cannot pronounce.
Wow.
As soon as I started the doxycycline, I've been on fire down there since then. And he said, well, that can't be possible. I'm like, sorry, sir, but
well, yeah, I mean, you honestly just, I mean, he's just so highly respected. He's
that's why I'm just like, I treat him like God.
Yeah.
And my therapist said, no,
no, you
he
have
is not God.
Yeah,
He is
no,
a
you gotta
human.
be active and assertive and involved and communicate and follow your hunches and
Yeah,
all that sort of stuff.
My problem is that I and you, through your groups, through your support meetings, am telling him or suggesting things to him.
Yeah.
That he's not telling me that he can offer. And it's pissing me off because I can't keep doing this. I can't.
Well, I
mean,
think
since 2008. I mean, come on. I can't advocate for myself constantly. I've been in the ER twice in July.
Shit.
I can't. And my therapist says, we're not old school anymore. It's all about support groups and what have you, and what you learn from them, and you take to the doctor and say, can you try this? And I'm like, I can't do that. And I'm a nurse. I'm just like, no.
You know, what was so interesting is yesterday there was because I'm part of a bunch of medical Twitter stuff too. And there was a doctor ranting about health coaches. And he was saying, why would a patient, because there's this whole new industry of kind of health coaches, people who offer coaching over the internet that don't have training or expertise. They go take a coaching class for $1,500 and they become a certified coach. And this doctor was absolutely ranting about it, saying, why would you spend money with somebody who has no medical experience? That if you have a unique situation, you need to be with people who are trained, who understand the context and the anatomy and the physiology. And other doctors ranted, and then another doctor stepped in and went, but what you're missing here is that many of the internet support groups, just like you say, and like what I do, right? This is free. I'm absolutely a health coach. I have a lot of training, 27 years of training, including sitting on the U.S. Army IC research panel for almost a decade. So I know my stuff. There are moments when you have to follow your hunch. Remember when I talk about subtyping and everything, right? When we talk about that at the international level, they're all talking about this in their own way. They're talking about phenotyping. They're talking about subtyping. There is debate here. Like everybody has agreed for 5 years, Hunter's lesions are completely different. And now somebody just published a paper in which they said, no, Hunter's lesions are the same. It's like, no. So there's a lot of, we're getting there. We're getting there. We're understanding the diversity more. And that's the problem, is that even somebody as renowned as Dr. Moldwin, Dr. Evans, Dr. Peters, Dr. Payne, Dr. Hanno, a whole new world is emerging. And it's our description of, and our history and our hunches and our, like the guy, that I've talked about so much, who was a surgical injury patient who said, it hurts right here. It hurts right here, every time, right here. And they kept saying, I see. And I'm like, no, it's not IC. I said that to him. It's not IC. You have a spot. We have to understand that location. And when they went in surgically and they looked, it was a black gangrenous tube. And so no doctor would have been able to figure that out until they looked. And so, honey, I hear your pain, and I understand your frustration, and I understand your anger, legitimately so, that you want to be able to go to a doctor who can fucking figure it out for once and for all. And I'm sorry for swearing. Guys, I'm sorry for swearing, but there are moments when it's appropriate. And you facing surgery, now emergency surgery in 2 days, girl, I want you to be cursing up a storm. And you have the right to be angry.
Oh, yeah.
And the doctors understand that. You have the right to be angry. Okay? And so you are the gift to the rest of us and to Dr. Peters, because hopefully in doing that surgery, they will be able to unravel your unique presentation, which will then help others, right? That's what we hope for. Now, what are you doing for pain? Did he give you stuff for pain?
He says opiates don't help with it. My primary doctor did. I'm on Norco
Good.
3 times a day, and oxycodone. I just started that for breakthrough, and it's not touching it. It's not touching it. I'm already on Neurontin.
Okay.
I'm already on a muscle relaxer.
Okay, so guys, now listen. Oh, look, I just did my chair. Hold on a sec. I do this every now and then. Okay. Now listen, for everybody watching this right now, you have to understand that what is happening to Heidi is unusual. This is not typical in any way, shape, or form. And Heidi, you know that. IC patients are not rushed off to emergency surgery unless something dramatic and serious is going on. So I don't want anybody watching this to think that it is in your future. I'm
unique.
She is unique. Laura and I just let you in, but that's why we're here. And girl, I've been there. I was there 3 years ago. I understand the tears and I understand everything. And you have every right to let it go. Let it go.
I think last time I talked to you, I was crying as well.
Yeah.
And I took a break from going on.
Yeah.
Because I was just like, oh.
Okay, so
it tears other people apart too when you see me like this.
Well, again, we don't know. I mean, at this point in time, well, obviously, you can't tell us, but it's clearly not normal.
No.
Okay.
No.
Okay. So hopefully,
but it's okay. It's okay. It's between him and I'm not allowed to speak about it.
Okay, that's fine.
And then after that, I can speak to you. I just wasn't allowed to put it on Facebook and stuff like that.
Good.
Of what he's doing.
Well, it's private. It's private. It's personal. And guys, you don't have to say anything. If I ever ask a question that you handle, honey, you handled that perfectly. I love the way you answered that. So you keep us posted. And in the meantime, listen, I want you to be doing, you remember the whole anxiety protocol? Stop sign. When you start having a negative thought, I want you to visualize the stop sign. I want you to take a nice, slow, deep breath in for 3. Out for 3. And then I want you to say something comforting to yourself. It's a reality check. It's like, I am in great hands. I'm with one of the best doctors in the nation. I'm not God. I'm going to assume that this surgery is going to be perfect and we're going to figure it out, right? I want you to walk into that surgery really focused on everything good that can happen with this, okay?
It's pretty sad when he calls you on a Saturday.
Girl, I've been there. I got called in my car with my mom stopping at the grocery store, and you hear that voice. You hear the doctors, good news travels by email, bad news travels by phone, right? And everything stops. Okay. But the good news here is that you're going to be over this. I want to talk to you tomorrow or tonight. Let's figure it out. See what we can do to help you during that recovery time. For everybody watching, I want you to please put Heidi in your prayers because she's gonna be on an adventure in the next couple of days. Okay? And we will see you on the other side, my friend. And honey, what's the symbol? What's the symbol for hug? How about just this? Honey, big, 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 giant hug. And as you're going through this, please remember that we're right there. Marianne says the Zoom meeting stopped. Yeah, everything's itched out. Marianne, I'll put the new invite in for you. I started everything back up. Here, hold on a sec. Hold on. Wait. Nothing bad's happening. I'm just finding my link. Hold on. Copy, invite link, invite link copied to my clipboard. Paste into Facebook. All right, Marianne, feel free. All right, Heidi. Hey, man, pop me your email. Pop me your phone number and I'll call you after the meeting, okay? If you want to talk, okay. Or tomorrow, your choice.
No, that's fine.
Okay.
I can talk. I just can't do it on the World Wide Web.
Okay. So icnetwork@mac.com. Pop me an email, okay? All right, hon, I'm going to mute you. Just letting Gina in. Hello, Gina. All right. So, Sarah. Let us unmute Sarah. Hello, Sarah. Let's see. Hold on. How are you doing today, hon?
I'm doing pretty good today, but everything gets me real emotional.
I know.
You know?
It is.
Even for all of y'all, it gets me emotional. For you all, also. I learned a lot of things. I learned that I had pelvic floor dysfunction, and that's why I was having to cath. That's why my bladder wasn't emptying or opening on its own.
Okay.
I learned that I had vulvodynia. And I started a clinical trial.
Really?
You know?
On what?
And on bladder installations.
I wish you guys could see her.
I have 2 toddlers and a 12-year-old, and I'm just trying to push them out the dining room, you know? So I learned a lot, and I met a doctor that actually looked at me and looked at my face and looked at me with understanding that I never had in my life.
Oh.
And I know that so many women out there go without ever having that feeling, having the feeling of someone to look at you and to really understand what you're going through.
I know.
You know? And I just wish that the blood in my urine would go away. That's what I would wish, you know?
So, okay, so I'm not sure everybody can hear you. I'm going to try to, you guys, I'm sorry. I don't want to be like in your face like that, but I do have to try to move my mic a little bit closer so people can hear. So just to kind of summarize what Sarah was saying, if anybody missed it, Sarah finally found a doctor who looked at her eyes and believed her and gave her comfort and affirmation and hope. And that it's so wonderful to get. I remember for me, it was Dr. Marshall Stoller, who I walked in his office. He took one look at me and he said, "You're in agony right now." And I just burst into tears. It was like the first doctor who actually saw me and saw what I was going through. So she was having trouble. So Sarah, you were having trouble urinating, and they figured out that you have extremely tight pelvic floor muscles, right?
Yes, and I also have Hunter's lesions also.
And you have Hunter's lesions also. Okay.
Yeah.
So then it's probably the Hunter's lesions that are weeping. You say you have blood in your urine. Can you see the blood in your urine? Are you peeing pink, or is it microscopic?
It's microscopic.
Okay, so most IC patients have I've had microscopic blood in my urine my entire life. I mean, I can't remember not having microscopic blood. And generally, in fact, I just put a tweet out about it because I was reading new guidelines from the American Urology Association and another group on how to evaluate microhematuria like that. Anyway, not particularly worrisome. Once they do the basic, they rule out uterine. I mean, they rule out bladder cancer, because sometimes bladder cancer cells. Once you have the urine cytology test and that comes back clear, the microscopic blood is, again, it's usually something related to, you've got some sort of wound here, and your body is sending it's sending white blood cells up to the area to fight. Then there's a little piece of biological trivia for you. So the green ones are the nerves, right? The green ones are the nerves, and you can see the blood vessels. So your immune system is triggered by these cells. It says, help, help, help. There's a problem. Something's where it's not supposed to be. Your immune system mobilizes the white blood cells to come to the area, and they swarm up into the area through the blood vessels, right? But so here's the blood vessels, but the invader's up here. So how does a white blood cell get from the blood vessel, the capillary up here? The answer is the capillaries open and they release them. And so when they release white blood cells, they release red blood cells. And that is, I think, why we have microhematuria, or just a little, anyway.
Without the blood in my urine, I would have never found out I had IC, because I just kept going to the doctor over UTIs, and they never found bacteria. They just found the blood,
Well, and so again, when did this start for you? Well, number one, if you don't mind me asking, how old are you?
I'm 31.
Okay. And when did this start for you?
The constant urinary tract infection started around the age of 15, and I found out I had IC at the age of 21.
Okay, so let's go back to
gynecologist.
Okay, so
she's the one that figured it out.
Okay, so let's go back to when you were 15 for a moment. You said that you had chronic urinary tract infections. Were they ever able to identify a bacteria?
No.
Okay, so everybody guessed or assumed that you had infection, but
yeah, so they gave me Cipro and continued to give me Cipro for it.
Right, antibiotics over and over and over again. And of course, now we know instead that if the bladder is injured, it will give you the exact same symptoms. The bladder only knows one language: frequency, urgency, pressure, pain. You could have a bullet wound or a stab wound and it would feel like infection. That is how the bladder communicates to you that there's a problem. Okay. So I know you think it's recurring infection, but they never found recurring infection. And they never found active acute infection, for lack of a better term. So it does raise a couple of interesting points. Point number one was, how was your diet back then? Were you massively addicted to Diet Coke and stuff like that?
I drank pop a lot, but I'm from Kentucky, and my mama raised me, and she's from 1933, so she cooked the home cooked meal every single night.
I'm not worried about the home cooked meal or anything like that. I'm just looking at acid levels. You have to understand that.
And I ate tomatoes like I ate apples.
Okay. The challenge with life today, again, you have to remember that Deborah is saying, I used to get put on antibiotics whenever the doctor saw hematuria, and I later got C. diff because of them, right? Which is, Deborah, you're absolutely right. So follow my line of thinking for a moment. So you're blonde, okay? So you're
I'm bleached.
Huh?
I'm bleached.
Okay. Your ancestors are from what country?
They're Irish and German and Cherokee Indian.
Okay, that's all you need to say. Okay, Irish and German. So let's go back 5,000 years ago to what life was like in Ireland and Germany. Was there acid? The only acid they had was in the spring when fruit was ripening. Otherwise, there was no acid in their daily life, unless by that time maybe they were making, here, Natalie, I'm letting you in. Would they have been making, I don't think they would have been making alcohol 5,000 years ago. I mean, that might have been 1,000 years ago, 1,200 years ago. Anyway, the point that I'm trying to make is that your body was not designed for life with a lot of acids. And we also know that it takes 5,000 years for an evolutionary adaptation to occur, right? So we know that the fastest cheetahs survive because they can catch food. We know that the fastest gazelles survive because they can outrun the cheetah. So we know that evolutionary adaptation occurs. But evolutionary adaptation occurs with how our body's built and with our bladder and stuff like that. Okay, so my family's from Norway, Arctic Circle. We had no citrus. We had no chocolate. We had no oatmeal. And when I think about the diet sensitivities that I have today, it makes total sense. My body hasn't built defenses for some of these foods. And the problem with life today is we're eating an international diet that is incredibly acidic, that for me as a Norwegian is challenging for my body because my body doesn't have defenses for it. And you as a German and Irish, you're the same. We're the same. And so I'm going to argue I believe very successfully is that eventually the acid takes a toll. And we started drinking soda and stuff when we were kids. And if you poured acid on your hand every day for years, I mean, for days and days and days, eventually it's going to turn red and break down. If you look at the FDA approval for NutraSweet, bladder irritation is the #1 side effect. Why? Because the acid level of the metabolized sugar combined with the acid level of the soda. So I think that we could make an argument that perhaps your symptoms began with a bladder wall irritation, perhaps from soda. Maybe, maybe not.
Or rollerblading. I went to the roller rink a lot, you know. I could have done damage then, falling, you know.
Well, that's the second thing is maybe it had nothing to do with your bladder wall. Maybe it has everything to do with you falling on your butt a couple of times roller skating. And when I go back to when I first had symptoms, I know I fell on my tailbone because I could move my tailbone around for months afterwards. I broke the tip of my tailbone off. So that's argument.
Roller rink was like 5 minutes from my house, so I went a lot.
So that's argument number 2. Argument number 1, bladder wall irritation. Argument number 2, pelvic floor irritation. And the odds are, I mean, you'll never know. But if I had to guess, I would think that it would have been maybe a combination of the two. Your bladder wall is just a little bit provoked, not enough to give you symptoms, not a big deal. But then, bam, you fell hard a couple of times right on your butt. Your pelvic floor got tight, started restricting blood flow to the bladder. The bladder became more vulnerable. And it was at that point in time you started feeling more frequency, urgency. That would be my guess, right?
I wish I felt some frequency and urgency now, because now I take baclofen 4 times a day and Flomax twice a day, just so that I don't have to catheterize, you know.
So we have a giant clue here, and the giant clue here is you have massive pelvic floor tension. If you couldn't pee, you have massive pelvic floor tension, which again points back to pelvic floor injury. IC subtype 3 pelvic floor. It sounds like your pelvic floor is the driving force here. And the fact that you've responded well to pelvic floor physical therapy is fantastic, but
I've not had pelvic floor physical therapy. I had last week my first treatment on my pelvic floor.
Okay.
And it was injections into my vagina. Pain injections inside of my vagina wall. I had it last week.
Has anybody tried to work with your muscles yet?
I just found out I found out on the 15th of July that I had pelvic floor dysfunction. I never knew before then.
Okay. So that's your next step. And so what you have to do, you have to get this book. You have to read this book. You have to study this book. It's called Breaking Through Chronic Pelvic Pain. It's free on Kindle Unlimited. I'm not saying what I'm saying is knowledge is power here. And it's important that you understand that your pelvic floor is like a 3-sided box, right? So if I can kind of it's kind of like this. So it's
That's
open
kind of
up.
the way Miss Abraham explained it.
Right. And so you've got muscles that go from front to back, but you've also got muscles that kind of go up the sides, right? So you basically have muscles that go from left to right, front to back, low to high. And it's this complex weave of muscles. And there's 3 layers of muscles. And so what we've got to do is now figure out where the muscle injury is, which muscle group is messed up, because one of those muscle groups is messed up for you. And it could very easily go back to you falling a couple of times, weakening the muscle in the area, you ending up with long-term trigger points in the area. Julie just says it's the best book ever for information.
Okay.
And
I'll get it.
it is stunningly good. Stunningly good. And you have to study it like you're back in school. You just have to. To really understand. As an example, let me just kind of give you an example here. Okay, so I don't know if you can see this: hip bone, sacrum, spine, right? So we got the big hip bones. And you can see this muscle that goes from here and from here. That is the piriformis muscle. That's one of the muscles on the sides. And this picture shows, and it will show you where the nerve goes. The nerve goes through the piriformis muscle. I mean, anyway, listen, guys, seriously, you are an here, this is an even better picture. So you can see the muscles kind of from the side, and can you see the nerves going through it?
Yes.
Kind of, sort of. Okay.
Is that why Valium suppositories help so much?
Yeah, because the Valium suppositories relax muscle. It relaxes muscle. But, you know, we got muscles and nerves and bones. Everything's together. Everything's together.
So when I go in every 6 months to have my hunter lesions cauterized through the hydrodistension. Is that not the way that I should be doing it?
Well, okay, so we've got the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor? You have both involved. There's no doubt that they're both involved. Generally, what we find is one is driving the other. And so we don't know why you have irritated nerves in your bladder. Could it be that the reason why the nerves are irritated is because your muscles are tight, really, really badly tight and compromising it? Yeah, it's possible. It's absolutely possible. And it could be the opposite. It could be that you've got a nerve in your bladder wall that's, I mean, it's both. So you're not going to know until you do the pelvic floor work. And you're going to be doing pelvic floor work for years, you know, until the Hunter's lesions resolve, things improve with that. You obviously have children. Your pelvic floor changed when you have children anyway, right?
Well, I have a 12-year-old, and then it took us about 2 years we took 2 years of trying to get my 5-year-old that I have now when my son was 5. It took us 2 years to get pregnant with her. I could never understand why it took so long for me to get pregnant with her, but I've also never had a regular period.
Well, okay, so
and birth control doesn't work on me at all. Like, I've been on my period right now since June the 11th.
Okay, and so this opens up a whole nother can of worms here, because clearly your hormones are very, very dysfunctional. And what you may not understand is your bladder relies on hormones too. That estrogen helps you create.
So that's why it burns so bad. It burns. It always burns.
Where is it burning?
Through my urethra, like razor blades.
Only in your urethra?
Yeah.
Okay, so I have a really good blog on our website called The 7 Causes of Urethral Pain. So let's go through those really quickly. Number one, your urethra is kind of like the canary in the coal mine when it comes to estrogen atrophy. The bottom half of the urethra is really sensitive to changes in estrogen. And so it's usually the first part of the urinary tract to react when you're struggling with estrogen levels. But you're young, but your hormones have never, your hormones are screwed up. If you've been having a period for weeks and weeks now, we know that something.
See, I tried the Mirena and they told me it would stop my period, and I bled for 9 months. I tried the Depot shot and it never stopped my period either.
Yeah.
I tried several forms of birth control, but they've only just made me bleed more. And when I'm on my period, my bladder hurts more than any other time.
Do you have fibroid tumors? Do we know what the health of your uterus is?
No.
Do you have
But Elise Abraham has scheduled me an appointment to have ultrasounds done on my uterus and my ovaries. In a couple of weeks, I have an appointment to do that. And the gynecologist I have been seeing just has offered me a hysterectomy. But I'm only 31 years old and I only have 3 children, and I may want to have more children later on in life. You know, I don't know. But
well, so
I don't want to have a hysterectomy. I don't want to have my organs removed.
I hear you. And there are women, including Diane, who helped me start the IC network, who had a hysterectomy at 21, and it was completely inappropriate. She didn't need to have the hysterectomy. It was never her uterus in the first place. It was her bladder. And so I hear you. I totally hear you. But now, to everybody watching here, now listen. Sarah's case is the perfect case of where you cannot assume it's the bladder, because your hormones are really strange. And
she told me that the pelvic floor controls all your reproductive organs also.
It does.
Is what she told me.
It does. It does. So for anybody who says that this is all I see and a bladder therapy is what's going to cure you, that's stupid. That's stupid, because in the end, it would not address your pelvic floor, and we do not have a clue what's going on with your hormones. And that's, have you gone to like the University of Kentucky? Have you gone for like a second opinion or anything at all like that?
I have a second opinion at another gynecologist soon. But the urogyno, Elise Abraham, that I met, she told me that that I could see the gynecologist there if I wanted to, but the Louisville is an hour away from me, so it is a travel distance for me to see Elise Abraham.
Right.
But she works with the bladder and the pelvic floor. She's not working with the uterus.
I think it would be really interesting to talk to her about how your hormones might be influencing your bladder and your stuff. So let's just get back to your urethra really quick. So number 1, is your urethra burning because your hormones are screwed up? The answer is it could be. It could be, we don't know. But that, I know for me, that started when I was a little bit older, but it felt like there was a drop of urine stuck in my urethra that would not come out. So do you feel like there's something in your urethra that's kind of stuck there? Yeah,
that's
you do?
How I feel. I feel like no matter how hard I push, it doesn't.
Okay, so
I also can never empty my bladder on the
okay,
own.
so stop pushing. Stop pushing. No more pushing.
You sound like a doctor.
You're just gonna mess up your pelvic floor. So I guess number 1 would be the quality and health of your skin on your vulva. If you're urethra, and you could talk to them potentially about, would a topical estrogen cream be appropriate at the entrance of your urethra to help improve the health of your skin? Okay, so that would be number 1.
This is the medicine that they gave me for my vulvodynia.
Okay, so that is a compounded, we call that an Amibach cream. It's a compounded amitriptyline, baclofen, gabapentin cream. This is great. This is good for people to see.
I've never been so much more comfortable, though. I mean, they also gave me a health guide through it.
Okay. But remember that okay, chicken or the egg. Yeah. I mean, ultimately in the end, you got everything's on fire. Everything's involved down there. At this point in time, everything involved. You got your vulva's burning, your urethra's burning, your bladder's burning, your pelvic floor is all screwed up, and you're having your period for long periods of time. You're going to have to break it out into little manageable sections. So come on over to our website, read the section on urethral irritation. You got to look at chemicals. If you wear mini pads, if you use douches, if you use Irish Springs.
I'm using Cora pads. I'm using the Cora brand.
See, that's
what I'm using. It says it's organic, unbleached.
Good. Good.
Pads.
That's good. That's good. If I put on a pair of underwear washed in sheer tide, I will have vulvar burning within 5 or 10 minutes and urethral burning. And
I use Ecos or the Ecos natural plant laundry detergent.
Good. What bath soap do you use?
I use a Rose Essential. It's the Whole Foods brand gels. It's shower gels.
No, you can't use that. You can't use. I don't think you should be using that. Hold on. Turn it around. Let me see the other ingredients. Okay. Yeah, see, the challenge is look at this. So it's got sodium. No, turn it back. No, turn it back. So I want to see the ingredient. Leave it right there. So it's got fragrance in it. It's got sodium chloride in it. It's got benzyl alcohol in it. It's got phenoxyethanol in it. It's got ethyl hexylglycerin. Yeah, no. I don't know.
See, I bought it because it says it's without all of this.
No. You got to look at the ingredients. Just look at all the alcohol in it. Yeah, it says gentle and effective.
So it's misleading me into thinking it's safer for me because it doesn't have all of this in it, but it still has all of the extra stuff in it, right?
No, look.
Okay. And does that come at Whole Foods also?
No. You can get it from us. Basis for sensitive skin.
Okay.
We have yet to find a gel cleanser that is not irritating. If not just for the fragrance.
I thought since it was out parabens, phosphates, or sodium lauryl sulfate.
Yeah, but yeah.
I thought it was.
Well, I mean, we've all made that mistake. We've all been there, girl. I mean, when I was in my 20s and I had vulvodynia for years. It felt like somebody'd rubbed sandpaper over my vulva, and all they said was, you got the most sensitive skin in the world. And it's like, you're a redhead, you have sensitive skin. But now we know in hindsight.
My 2-year-old, he's a ginger. I have my family is filled with just gingers.
Right. Okay, so yes, we have more nerves anyway because we're redheads. That's a biological fact. We definitely have more nerves, but ultimately, in the way, we are also going to be more sensitive to chemicals, even fragrances. And so you go to any vulvodynia support group meeting. Rule number 1 is you can't use anything down there that like what you're doing. We all learn that gels don't work, but this is what I use. Basis soap for sensitive skin. This is by far the best soap. You might be able to get away with a plain Dove bar with no scent, but this one,
What about the Stay Moisture one that's for sensitive skin?
No.
Mm-mm.
No? It's not.
Okay.
It's not just the typical marketing of more natural. You have to look at the ingredients. And the one you're using, I think would burn me, and I don't think you should be using that because the other challenge here is you're wearing a pad all the time because your periods are so long, and that's sucking out your natural moisture anyway. So you're going to be a little bit drier anyway, which is going to make your skin a little bit less resistant to chemical irritation. So anyway, please go read the blog, The 7 Causes. It goes over that. There was a big class on pelvic pain 2 years ago. I had it in my magazine. The very first thing they said in the class was, you got to get rid of all the chemicals down there. Nothing. I mean, they didn't even want, I mean, literally, they want you to use a Perry bottle, rinse yourself off with water, pat dry, and only use soap on your pubic hair where there are oil glands, and you don't use soap on your actual vulva. There's another book that I think you would really love.
Well, I love to read. It's not good for me because I usually can't. If I start a book, I gotta finish it right away.
Oh, this these are like, this is like homework. These are like textbooks. You're not
Okay,
gonna
you
The Vagina Bible by Dr. Jen Gunter came
I've
out
heard you
in
speak
December.
about that one before.
To everybody watching, this is a perfect gift for Christmas for all the women in your family. It's a hysterical gift. It's so good, and it will go over everything you need to know about cleanliness, about birth control, about what that does to your skin, about various illnesses, bacterial vaginosis, and there's a whole chapter on vulvodynia. So between this chapter on vulvodynia and this chapter on vulvodynia, because again, if your muscles are tight, your vulva's not getting the blood flow it needs to be healthy, and your vulva's going to start to break down. So yeah, we got your skin is on fire. We're going to have to calm and soothe your skin. Make sure you're not triggering it with chemicals. But underneath it, we have to understand that the cause is probably just really tight, screwed up muscles.
Okay, can we speak about the clinical trial that I started with the Kenalog steroid? Do you think that's going to be a possible help or work?
Well,
or
yeah,
work?
it might be for your Hunter's lesions. Yeah.
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 I've only had 2 of the installations, and they are so much better than a DSMO treatment. I wish I've never ever got one DSMO treatment ever.
Well, and
I don't understand why some urologists are still giving it to people if it's doing more invasive damage than it is doing good.
Well, Laura, we have it. I just have to put it back. I'll do that this afternoon. DMSO has been falling out of favor as a bladder installation for decades. It is irritating. We know that at the FDA approved dose of 50%, it can cause bladder spasms, in some cases irreversible bladder spasms, produced in research animals. I was at the conference that presented that data. Most urologists do not, most of the top urologists do not use DMSO anymore. They prefer to use rescue installations, which is a heparin lidocaine or an Elmeron lidocaine installation, because it rescues you out of a flare. It turns the pain off. But
with the baking soda in it too. I don't know the medical term for baking soda, but
yeah,
they also do that also, right, with the lidocaine?
Well, the baking soda, sodium bicarbonate, helps it move across the bladder wall. If you alkalinize it, it goes to the skin more effectively. So a good installation is always going to have a very precise amount of sodium bicarbonate to help it be absorbed. And then the lidocaine for the numbing agent. Do you feel, have you had a rescue, and did you feel good when you had a rescue installation?
I don't think I've had any other installation besides the DSMO and these 2 clinical trials. Other than that, I've never had any other kind of installation.
Okay, so you got to do some reading on our website. Go over to IC Network, go to the section on bladder installations so that you can see the different forms that are available, because you already have a doctor who's giving you a very, very good compounded cream. The Amadoc cream that they gave you is really good for vulvar pain in the sense that it's fighting it in 3 different ways. It's calming nerves down. The amitriptyline is calming nerves down. The baclofen is relaxing muscles. And then the third ingredient was gabapentin, which also calms nerves down. So you clearly have a doctor who is up on new stuff. So you can ask them about some of the new installations rather than the DMSO. But DMSO is not the protocol for Hunter's lesions anyway. You know.
See, the urologist that I've been seeing him for 5 years. He's never not been helpful, and he's never not given me the right prescriptions, and he's always tried to be as helpful as he can be.
Mm-hmm.
But I don't think he is up to date on what he should be up to date on because he's not a specialist in IC.
Probably, and that's where you get to walk in and be the educator, and that's important. That's what we have to do. There are very few specialists, so we have to walk in confident, strong, assertive, prepared to talk about our symptoms, and prepare and knowing the guidelines ahead of time, bringing a copy of the guidelines with you so that you can be assertive in that discussion and say, I would like to follow these guidelines. What do you think of this, this, and this? And many doctors don't even know the IC guidelines are out, even though they've been out for 9 years. So anyway, well, listen, hon, I've got to move on. Oh, there's your daughter. Hello. Hi. Hi there. How are you? Are you happy? Oh.
Say yes. Yes, sir.
Oh. Hi. Hi.
That's not Nimble, okay?
She's so cute.
No. He's a boy, actually.
Oh, it's a boy. Oh, I'm sorry. Hello, young man. Well, he's so cute. Hi.
His name's Avery Remington.
What is it, Avery?
Avery Remington.
Hello, Avery Remington. Look at you. You're such a big boy. Bye. Okay, hon. I've got to move on. Nice to see you. And if you want to talk, give me a phone call. I mean, you're a perfect example of how complex this can be for some people.
Thank you so much, everyone. And
you're not alone. He is adorable. Bye-bye, Avery. Bye, Avery.
Say bye, Avery. Bye.
That's adorable. Oh, my goodness gracious. Suzanne, you have been sitting there listening to everything, and I'm trying to unmute you. Can you unmute yourself, Suzanne? There you go.
Okay.
How are you, hon? How are you doing today? How is life?
Thank you for doing this.
You're very welcome.
Well, okay, so I have IC, vulvodynia, pudendal neuralgia, PFD, as so many of us do. So I started getting the hydrodistension, trigger point injections, and pudendal blocks.
Okay.
Probably 5 years ago. I do it every probably 6 to 10 months.
Okay.
And it helps a lot. Recently, on the last one, maybe 2 times ago, he said I had Hunter's lesions, which was new. And so this last time, 3 weeks ago, I had the Hunter's lesions injected with whatever they inject them with.
Okay.
And this has just been a super hard recovery. The pelvic pressure and I'm still worse than I was before the surgery. And I haven't gotten them I have just a gynecologist who's been around forever. He's in his 70s, and he does the surgery, and he has been my gynecologist for 22 years, and a urologist. That would make the recovery worse. That it's just on July 10th.
Okay, so you're a couple weeks out.
Yes.
Okay. That's interesting. Did they do they did a normal hydrodistension? Did they do anything else different besides injecting the lesion? Did they use a different fluid? Did they stretch it more?
That I know of.
It would be interesting to get your surgical notes.
True.
And
I did go back a week and a half ago, and I had a UTI. So and I usually don't because he puts an antibiotic in my IV when he does this surgery, but he put me on Septra maybe, and then I went back 2 days ago and the UTI is gone because I kept thinking, well, it's UTI. That's causing more pressure and pain. And as soon as I get rid of the UTI, it'll be fine.
Right.
But I just didn't know.
Well, I mean, you and Sarah are like sisters. I mean, you guys have exactly the same thing. So you've got pelvic floor issues, you've got bladder issues, you've got Hunter's lesion issues. Now you've got vulvodynia. And the thread that connects them all is your pelvic floor, And so how old are you?
47.
And when did your symptoms begin?
32.
Okay. And so what was happening when your symptoms began?
Stress.
Okay.
I had just gotten married and had a teenage stepdaughter. And now I also went through menopause at 37. So and then I had a hysterectomy at 40.
Girl.
So
holy moly. Okay. Why did you go through menopause at 37? Was just genetics? That's just your family?
I don't know. My mom was 60 and my grandmothers were in their late 50s. We don't really know. But I feel like, the hormones are probably, I'm on the hormone patch. And
I mean, that's
so I don't.
Were you an athlete? Do you remember, were you in any car accidents, falls, anything like that?
Nothing like that.
And forgive me for asking the same question. Have you had, so you had a stepdaughter, have you had your own children?
I have not.
Okay.
No children.
Were you, I mean, there are questions that are, I don't want to embarrass you, but let me just ask you this question.
No, you won't.
Were you somebody who dreaded going to the OBGYN for your annual exam because you knew it would hurt?
Yes.
Okay.
Starting from the first time at the age of 18.
Okay. Was sex uncomfortable when you started? Okay. So what that means then is that you probably have had vaginismus. Vaginismus means extremely tight pelvic floor muscles. And muscles so tight that you cannot tolerate inserting a speculum, that it really hurts. And so this goes back to kind of two fundamental reasons here. Either something happened when you were younger that triggered those muscles to be tight. And an example would be, I have a creepy example. I'm going to give you let me give you a creepy example. I'll give you two examples. If you were a bedwetter, and I was a bedwetter until, I don't know, like second grade, something like that. If your parents didn't handle it correctly and they beat you because you wet the bed, that child is going to naturally start tightening that muscles, right? Sure. Or if you did ballet, this is very common in young dancers. You're taught to tuck your pelvic floor under, and that completely messes up. By the time you're 19, 20, 10 years of ballet, your pelvic floor muscles are screwed up. Elite athletes, high school athletes who then become Olympians and marathon runners, their pelvic floor is so bad, many of them are running with pessaries. That accumulative trauma would be an issue. The creepy example is a man who, his mother forced an enema on him every day before school. If he hadn't had a bowel movement, she forced an enema. You can bet by the time he was in his 50s, his pelvic floor was rock hard. And so, or as this book talks about so well, anytime we have somebody with long-term chronic pelvic tension, we have to take a step back and look at bony structures. Is there something dysfunctional that's putting abnormal stresses on your pelvic floor because of your bones? Do you have one leg longer than the other? Are you pigeon-toed? Are you pigeon-toed where your toes are in, or duck-footed where your toes are out? Or do you have, again, if you have one leg longer than the other, the short leg has a big arch, the long leg has a flattened arch. So is there something mechanical going on, something in the way, or scoliosis? Do you have scoliosis, anything at all like that, that would put long-term chronic stress on those muscles?
Not that I know of. I did have a ruptured disc at 31 in my L5, and I had surgery on that.
Well, L4, L5, that's the area where the nerves for your pelvis come through. You had surgery. The response to surgery would be a guarding reflex. Your muscles would be getting very tight. But the reality here, and the thing you got to tell the doctor, is that from the very first time you had an OBGYN exam, it hurt. That's very clearly vaginismus. That's very clearly vaginismus. And so to me, I think that your muscles have to be explored more in depth, because it's the tight dysfunctional muscles that are going to cause the bladder wall to break down, going to cause the vulva to become more irritated. It's going to be squeezing, compromising nerves. And could tight pelvic floor muscles lead to the development of Hunter's lesions? Possibly, because the nerves are being compressed and dysfunctional and diseased. And could that lead to ulceration of the bladder wall? Possibly. So I would be spending your time working on those muscles as much as you can. I mean, you guys remember, I'm not a doctor. I can't give you medical advice. I'm just trying to give you context here. I'm trying to open up as many doors as possible so that we can explore if those doors might be helpful at all. But the fact that you have never found a vaginal exam comfortable, and the fact that sex is painful, points very, very clearly to your muscles. Where do you live? Don't tell me the city, but what state do you live in?
No, Mississippi. You can probably tell from my accent that it's from the South, but Mississippi.
David goes, you should be a doctor. You know why I didn't go to med school, guys? I'll tell you, because I do have a pre-med degree, and I did surgery for a year. I have a really rare degree where I did experimental surgery. I didn't have confidence in my calculations and my ability with dosages for anesthesia. That's why I didn't go to med school, just to be fully transparent there. I had to do my calculations like 5 times. It just wasn't natural. I didn't have the confidence that I was right with dosages. So anyway, what was I going to say? Okay, I totally forgot.
And I didn't tell you, I did do pelvic floor PT for 6 months, and I probably should have done it longer. It made me worse.
Exactly.
It made me flare, and it.
Okay, but
So.
Okay, but if they can test a muscle and make it worse, they're working in the right area. It
Makes sense.
it's the hallelujah moment. When you go in for your pelvic floor exam and they touch those muscles, if they can trigger that pain, hallelujah moment, that's it. What are you touching? That's it right there. So at that first appointment, you want them to touch things and find pain. And if they find pain, hallelujah, babe, that's it. That's where we need to work. It's at the subsequent appointments that they back off. They shouldn't be. You have to be super gentle with the pelvic floor. You cannot be aggressive at all. This is
and she was aggressive, and I would cry, and she would go into my bladder, and it was awful. And I said, I'm not doing this anymore.
And you made the right decision. If she was aggressive and hurting you, absolutely the right decision. This is a very, very gentle process. And so, this is the example that I use here. So, and the muscles don't curve this way. So, but this is just kind of a demonstration. So your muscles are supposed to be kind of long, right? And just long and pliant and relaxed and comfortable. A tight muscle cramps in like this. And so what they do is they use their hands and they very gently follow the length of the muscle just to try to get it to release. Try to get it back. Because what happens is your muscles, and again, this is not anatomically correct here, guys. Your muscles lock down like this. They get hard and knotted. And you have to go the length of the muscle. And sometimes you go across the muscle like this, right? To try to get that muscle to relax into its correct position. And this, again, will, I think, help you understand it. And then this book, Ending Female Pelvic Pain, has a really good list of things that you can do at home. You would never do a Kegel because your muscles are already locked hard. Kegels hurt. Kegels hurt me for years until I got my muscles relaxed a bit. But this one has, you know, just a whole bunch of things that you can do. And the prayer pose, guys, or if you're laying on your back, your happy baby pose. This is one of the best poses you can do because it forces the muscles into their proper position, but it's not aggressively. I mean, we don't want to force anything, but you know what I mean. It puts them in their correct position. So I think you need to find another physical therapist and get your tushy back into physical therapy, but be very thoughtful. And by this time, you will have read this. You will understand which muscle groups. You will be laying on your back as she's working inside of you going, okay, are you touching my levator? Okay, is that my piriformis? So that you can really visualize where they're working. Okay?
Okay.
And also the other thing in this book, again, getting back to why would you be tight in the first place? The chapter in this book, which is absolutely mind-blowing, is a chapter on the feet. That if you don't walk normally, that will cause long-term chronic muscle tension. And for everybody, the foot section is the last piece of this puzzle. Is why am I so tight? Why am I tight over and over and over again? And sometimes it just goes right back to how you walk. And if you have a foot problem or if you have a knee problem that could have begun in childhood, right? You just don't know. So a good physical therapist will have you walk down a hallway and watch how you're walking. And that's important. We have to see how you're walking. Okay?
Can I ask you one more question?
Yes, definitely.
Okay. I have a chiropractor and she's not, you know, very well versed on all this, but she's willing to learn and listen. Do you think that would be worth exploring? Or should I stay away from that? Just your opinion.
I think that chiropractic can be very aggressive. And so I told the story of in our newsletter last year, it was about a year ago, of a lady who attended one of these meetings. And she'd been on bladder therapies for years and none of it worked. And she learned about the subtypes and she learned about pudendal neuralgia. And she thought, you know what? I think I have pudendal neuralgia. So she went to her doctor and the doctor went, yeah, you have some of these symptoms. And so they did an x-ray or whatever exam they did. And what they found was that her tailbone, your tailbone is normally like this, right? It's like slightly curved outward. Hers was like this, and it was bent to the side. Like her tailbone was really, and there's a lot of people here who have tailbone issues. And what that did to her pelvic floor was stunning because the muscles that were attaching there were completely distorted on the opposite side. So she did physical therapy and it was partially helpful, but as long as the bone is out of position, the muscles are going to be strained. So she did commit to chiropractic. And it was the chiropractor she had chiropractor once a week for like 9 months. And they finally got her tailbone in the correct position and her symptoms went away. That she 90% better. She never thought she would be better. 90% better. And she went on to have babies and her life is back. And so if I would start with the physical therapist first, try to have a discussion on, and teach me about my anatomy, tell me what's tight. Now, can you help me understand why this would be tight? Is there any chance that there's something else going on which is putting stress on this muscle? And it's at that point in time that, let's have a little bit more info first.
Okay.
I will say, Lindsay says here, chiropractic has been a godsend for me. I just couldn't go without it. He keeps my limbs from turning purple and blue from chronic regional pain syndrome. It can irritate my IC, but he works with me when things are just too flared. Hi, Gay. Hope says, the foot section in the book resulted in another aha moment. So I've done chiropractic a couple of times for my SI joint. And I've got a very, very dear friend who did chiropractic last year, and they used a drop table, and he now has spinal cord damage from it, and nerve damage from it. And so I just wouldn't. Here, Christy says, oh my God, the foot. My IC symptoms started after 4 months after I broke my foot. I had physical therapy for my foot, but I wonder if that was the trigger for my tight pelvic floor. Christy, yes, it was. Yes. All right. So are we good here?
Thank you so much.
Suzanne,
I really appreciate all of this.
You are very, very welcome. I hope it gives you just a little bit of context here, okay?
Absolutely. Thank you.
Okay. Natalie, and you guys, please don't take it personally if you're first or last. I'm just being random. Okay. Natalie, how are you, hun? I can't see. You got a picture. There you go. How are you doing today, hun?
Can you hear me?
I can hear you, but I can't see you. You're just a black face in front of a white window.
Yeah, I don't know how to do this.
You just have to turn. You just have to turn around and let the light shine on your face. There you go.
Oh, is that better?
Yeah, but keep turning. Keep turning. Keep turning. There you go. Perfect.
Technology.
All right, hun. How are you today? How is life?
I'm better today.
Okay.
A lot of what you were saying when I got sick, it was 2000. It started about a year before I had my symptoms. I had a kidney stone.
Okay.
And that came out of nowhere. And then it started slowly.
Okay. Whoops, hold on. Did we just lose her? Natalie, and it looks like we just kind of lost Natalie here. Let's see if she can come back in. That's her internet. Testing 1, 2, 3. Natalie, can you? Nope. Natalie, nope. Natalie is, oh, there you are.
Is it better?
Yeah, that's better. Try not to walk around too much. Just like park yourself in a chair.
I was sitting. I'm still sitting. I don't know. My internet's bad or something. I don't know what's going on.
Okay, so you said that your IC started.
It started really mild. And I did have UTIs.
Okay.
And then I would go to the hospital and they would say I had a UTI when I really didn't, pump me through full of antibiotics. When it got really, really bad, I finally had, my mom paid for a hydrodistension and I had the chronic urination. It was horrible. And they put potassium in my bladder and they filled it up to almost 40 you can't hear me?
No, I can hear you.
Oh, okay. They filled it. The guys told me, and I've read the records, that he filled it up to almost 40% and almost burst. Well, ever since then, my pain has progressively gotten worse. And I wonder why. I should have never done that. I'm glad because now I literally have medical records to prove something's wrong. But at the same time, I've gotten so much worse. And miraculous, I've never had burning ever, unless I've had a UTI. I've never had the burning that everyone says.
Okay,
talks
so
about.
let me ask you a couple of questions. Number one,
Yes, please.
how old are you now?
I'm 36.
And when did this start for you? When did you first have bladder symptoms?
Had my kidney stone at 21. 20, maybe 23, 24.
Do you remember having any issues when you were a kid?
No, but as I heard you guys talking, I always held my bladder. I always thought I could go 12 hours without having to go to the bathroom, and it probably wasn't healthy. And I didn't start my period till I was 16. And I also, same thing like her with the gynecologist, it always hurt, always hurt. I was in gymnastics when I was a kid. I've never.
Okay, that's all you got to say.
But not till I stopped at like 10, but yeah, I was in gymnastics, and I fell on my bike in the ouchie area.
Yeah.
When I was younger. And I've dealt with anxiety as a kid, always been tense.
Okay, so
Xanax
so
relaxes you better than pain medicine, really.
Okay, so let me ask you this. Have you had a pelvic floor examination?
Yeah, a
What'd they
long
find?
time ago, I did everything under the sun. Yeah.
But when you have okay, wait. And just bear with me. If you guys, for people who talk to me on the phone, you just know I do this all the time. I constantly interrupt. I apologize for that. I
do too. I'm sorry.
I'm just trying to visualize it in my head. When you had your pelvic floor assessment, what did they find years ago?
It wasn't really a pelvic floor. They put like a golf ball thing in me and had me do like Kegels.
Oh my God.
Yeah. Right. And recently I found this lady, Jilly Bond, and she's in England, and I've been reading about the Therawan thing. And I didn't know if that would, because with the Hunter's lesions, because the picture you showed with the red everywhere, if I find it, I can show you my pictures. They look exactly like that. It's all red. And there's like 10 pictures.
I know, but listen,
right?
We have to. So there are two critical reflexes in the pelvis. The challenge, as Dr. Weiss says in this book, Western medicine fails in the treatment of pelvic floor pain and pelvic pain because doctors stay in their safe zone. Doctors stay in their box. They don't play outside their box. So urologists look at the urinary tract. Gynecologists look at the reproductive system. Gastroenterologists look at the bowel. They are not so good at looking at how they influence each other, and they're terrible at understanding how muscles influence them all. And
obviously, I was able to train my bladder. I no longer have frequency. It's amazing. It's great.
Okay.
But the pain has progressively gotten worse and worse and worse.
Okay.
And I had to quit my teaching job, and
it's horrible. So where is the pain?
I've never had any kids, but it's in my lower abdomen, in pelvic. Sometimes it goes to the lower back. It feels like I sit with the pillow, like pushed hard up against it. Sometimes it's really tightening, almost like contractions. I've never had kids, but contracting. So, and sometimes it's really deep throbbing, and to the point where it's unbearable. I'm on very strong pain medicine.
Okay. So you're like checking every box for pelvic floor. You are. You just the way the way you're describing it, you're so is the pain in the center of your body, or is it to the left or right of center?
No, it's in the center.
Okay. Is it shallow or deep?
It's deep.
It's deep. Describe the quality of the pain. Does it feel like razor blades, or is it dull and achy?
No, it's not burn. It's dull, achy, tightening. There's no burning.
Okay. Okay. Does it ever feel like Does it ever feel like something's falling out of you or something's being pushed up inside of you?
No, it feels like someone's like squeezing out a washcloth, twisting it, to squeeze out the water. Does that make sense?
Okay. Does movement make the pain better or worse?
Worse. But what helps is pressure. In the beginning, before it was so bad, a heat pad used to get rid of it. But I sit with a pillow pressed up against it. So pressure up against it makes it feel better, but that's when it's mild.
So you're checking every single box for a pelvic floor muscle injury. You really are. Those are not symptoms that are consistent with a bladder wall in any way, shape, or form. Does the pain change during urination?
No, I mean no. No.
Okay.
During my period, it gets worse. Before I start my period, it's worse.
Okay.
Hormones.
Okay, but
if I wait too long to go to the bathroom, if I've slept too long.
Yeah.
But no.
So, does the pain get worse as your bladder fills with urine, or does it get, so the fuller you get, the worse you feel, and then when you pee, you feel a sense of relief? Or is the pain worse?
It's a different kind of pain that's bearable, and that's what makes it so hard, is it comes out of nowhere. It's like my bladder has a brain and I have a brain and they don't match up. It's I can't control my own body.
No.
It's like how,
Okay, so you're really not describing bladder wall driven symptoms at all. You're not. Because bladder wall pain is razor blades, sharp, ground glass. You're not describing that. So when you try to pee, can you start your stream right away, or do you hesitate? 5, 10, 15, 20?
No, that's only happened when I've had a UTI. No. And when I used to have frequency, I do 2 drops and everything, but ever since that's gone, no, everything's fine. And
so you can instantaneously pee.
95% of the time. Yeah. And that's what's so weird, is that it's.
So again, what makes you feel better? When the pain is really bad.
Medication.
No, aside from medication, what makes you feel better? Heat, ice, laying in a certain position?
Laying on my back with the pressure, and I've tried to deep breathing and stuff like that, and quiet. Stress is horrible. Any kind of stress, I'm real tense, and I've been in. It's all started during a real stressful time.
Okay. So, and during periods of stress, you subconsciously tighten muscles. So, I really think you need to see a really good pelvic floor physical therapist and at least have a proper evaluation. And you need to tell them you were a gymnast. That's critical here, because literally,
even though it was only till I was 10.
Yes, especially because you fell a lot. You fell on your tailbone a lot. Right. The 2 sports in women.
And my tailbone is big. When you guys were talking about your tailbone,
okay.
Does that make sense? I can.
Totally. So.
No, why would.
Go ahead.
Oh, I was just going to say, when they did my hydrodistension, why would the rest of only 40% of it be okay and the rest of it be frozen, or what is it? Can it come back? Is it in my, the way they explained it to me, I don't know how to, there's an open wound, basically. Does that make sense?
Well,
and so but the IC diet, I can eat a lot of the stuff, and I'm okay.
But wait. Just hold on a sec. So anatomically, in the pelvis, there are 2 critical reflexes. One is called the viscerosomatic reflex, also known as the guarding reflex. So when you're in pain, your body will tighten your muscles to protect you from that pain. Okay, so that's concept number one. We know an organ can change muscle behavior. But the operative question here is, Carol, I just let you in. The operative question here is, can muscles change organ behavior? Also known as a somatovisceral reflex. And the answer is yes. And so what Dr. Weiss describes in this book, and let me just, he's the one that just nails it. Finally, we understand the mechanics a little bit more. So let me, hold on a sec. Okay, so when you fell as a kid, so let's just say, I mean, you fell every time you fell every time you practiced, because that's what kids do.
Right.
So when you,
okay, this may be a stupid question, but my husband, when this started happening, he's very large. And I would tighten and tense, and because it's always hurt and
muscles,
bad.
When muscles are healthy, that's one of the things that I learned.
So it wasn't healthy in the first place.
Yeah, when muscles are healthy in the first place, they are remarkably pliant and stretchable. That was like the single most important thing I witnessed doing surgery on animals, which I would never do now because I love animals. But
yeah,
we could make a little tiny incision in muscle, and we could just literally use our fingers and stretch that muscle. Muscles do respond beautifully. And guys, I'm just saying, that's why I gave up pharmacology, is I love animals. Okay, I want to go back to setting the foundation for being a young gymnast. Every time you fall, you suffer a compression injury. You fall on your butt.
Okay.
So let's think about the mechanics of what happens when you fall. You compress the tissue. So we know you compress the muscle fibers. We know you compress blood vessels. How many times did you have a bruise when you fell?
Oh, I bruised. Yeah,
right.
Every time, and I bruise very easily.
Right. So bruising happens because blood vessels are compressed and they rupture. And nerve fibers are also interwoven, right? And what you don't know about nerve fibers is that in that nerve fiber, there might be two nerves. You got a nerve going this way, and you might have a nerve going that way, and you got a little blood vessel in there that's supporting both of the nerves, and that gets compressed and ruptured too. So the entire area is now damaged, okay? But you're young. Your body is live and limber and responsive. And so what we see is normally when you're young, you recover very quickly. The bruise goes away, yada, yada, yada. But every subsequent time that you fall, you suffer another compression injury. In the muscles, what happens is that muscle gets weakened. And the area where it's weakened, it gets a trigger point. It gets a trigger point. And so I want you to look at this picture. Everybody, it's so hard. I want to be able to see. So this is here, hold on. So these are muscle fibers going back and forth, okay? And then you can see the blood vessels and the stuff that are interwoven. Here is an injured muscle that now has a trigger point in it. And trigger points last for a long time. I have a trigger point right here that I've had for 20 years. In fact, I have this little jade stone, and I'm just constantly trying to get rid of it. A trigger point basically becomes a permanent compression injury. And because this muscle is now a knot, you can see that it is now compressing blood vessels and nerves, okay?
That makes
so
sense.
That's a knotty muscle fiber, and then this is the compressed blood vessel. And obviously, from this point forward, there's not going to be good blood flow.
Right.
The other thing that happens, and this one, this is a little bit harder to understand. Okay, so this is a close-up of the trigger point and a close-up of the nerves, right? And the blood vessels again. So this is what it says. An injured motor nerve continually releases acetylcholine, sending the muscle fiber into a sustained contraction. The contracted
Like a
fiber,
spasm.
right? The contracted fiber releases calcium, which promotes. Okay, wait, hold on. So, okay, you don't need to know the chemistry. Anyway, so the point here is that the nerves in the area are also now dysfunctional and damaged. And we have something called neurocrosstalk, where proximal nerves also become involved. There's something called allodynia, where all the nerves in the area become super, super sensitive. And it happened to me for about a month, where you couldn't even touch my belly without me crying. Everything down there was on fire because all the nerves were on fire. And eventually what happens is that the nerves near the bladder also become involved, and they become dysfunctional, and they release substance P, which then damages tissue and causes the diet issue that you have. Remember that your bladder can't be healthy if it's not getting good blood flow. If you got tight muscles, there was one study, it was really interesting. It was a study on pelvic congestion syndrome. The bladder is normally supplied by 24 units of blood. If you have pelvic congestion syndrome, you're only getting 9 units of blood. It is impossible for your bladder to be its best and healthiest if it doesn't have good blood flow, good oxygenation, good nutrition. So obviously, restricting blood flow is going to make the health of the bladder more of an issue. The bladder is not going to be able to grow and repair well. But then we got the other nerve injury going on, and it's actually the nerve injury that's going to potentially cause more tissue damage and the diet sensitivity. It's a chicken versus the egg. It's
right. And when you were talking to her about pushing, I had an IBS really bad, where I had an IBS constipation and I would have to push really bad, and I had hemorrhoids. And then it would switch back from diarrhea and both, and I still get it once in a while, and I'd strain. And that's not helpful.
I have I call it recto. Okay, so like so I had frequency urgency in junior high right at the time I broke off part of my tailbone. I had vulvodynia 2 years later. I had ovarian cysts, which didn't make sense. And then IBS hit when I was in my early 20s.
I have ovarian cysts and endometriosis.
No, I do not. I just checked for endo. I do not have endometriosis, but I definitely, I threw cysts like mad. I had so many cysts at one time. You and I are like sisters.
Do you think some of you think some of this is genetic? My mom has a lot of like similar issues.
Okay, so in the IC, my IC subtype is subtype 3 pelvic floor injury. There's no doubt that my muscles are the dominant force in my system. No doubt about it. But the landscape of my body is also IC subtype 5 central sensitization. Central sensitization means that we are born with a more sensitive nervous system. It is easier to turn our nerves on. And so we have very sensitive skin. You can see, I get red skin.
I have extremely sensitive skin. I have something called cuticle, where I'm like allergic to the cold. Since I was a kid, extremely, like if I hold like a can of pop, my hands will get red and welts, and it was really bad when I was a kid. I mean, I get hives. I have allergies really bad. All of that.
So, and my two, I remember I would get up at 5 a.m. for early morning workouts, and my hands turned blue, white and blue. It was terrible. Anyway, so central sensitization is the landscape. It's the way we are genetically designed, in a way. Right. Every tribe needed somebody who could smell good food versus bad food, smell good water versus bad water, right? Sensitivity is an evolutionary priority. The blessing of being sensitive is that we will be the first to smell fire. We will be the first, to tell if, I remember once with my parents, they were making bad bacon and I walked into the house and it was like so bad and they couldn't smell it. I could smell it. So my sister is an award-winning winemaker. And we have a wicked sense of taste. We have a wicked sense of smell. I could tell my boyfriend at the time everything he ate that day based upon kissing him after work.
Wow.
It totally grossed him out. It's like, I know exactly what you eat. I was never wrong. I could tell him exactly what he's eating. Okay. And then the whole smell thing, smell is a brain function, which is so interesting here and there was back in early 90s, UC Berkeley was doing a study on why IC patients had a wicked sense of smell. And it comes back down that for some of us, we just inherit that. We have a more sensitive nervous system, or we've sustained an injury, which causes all the other nerves to become sensitive. But the odds are the word sensitive has haunted you your entire life. They started telling you were sensitive when you were a kid. You probably couldn't use bubble bath. You probably couldn't do a lot of the things. I couldn't use bubble bath. It always burned. You want to be a kid.
Carol can't get in or hear you, Jill. Carol can't get in or hear you. She's in the chat saying so.
No, I'm in now. I'm in.
Okay. So
Okay.
that's okay. So I just mute you guys while I'm working with somebody, and then I unmute you. So just hang tight. I think we'll get there.
So if I have a question, do I just put it in the chat?
No, Carol, just wait for me. I'll be coming to you next, I think.
Thank you.
Or Lauren might be next, and then I'll be coming to you, okay?
Thank you very much, Jill.
You are very welcome. All right. So Natalie, the central sensitization is probably what you've inherited. It goes back on my family generations. It's not a disease. We don't treat it like a disease. It is a way we are hardwired. And, and you on a daily basis have to protect your nerves. I mean, it just is what it is. You can't have chemicals in your home. We are better in the country than in the city. Right?
I got extreme toxic mold poisoning too a couple of years ago.
Extreme what poisoning?
Toxic mold poisoning. I was in a house in Chicago where it looked like mud on the carpet, under the carpet. We didn't know it was there. My sister-in-law lived there. It was that thick. So we did. And I had a seizure as soon as I walked into that room it was the day they lifted up the carpet. The landlord didn't clean it up right. As soon as I walked in, I sat down, I had a seizure.
Wow.
Yeah.
And you're not there anymore, obviously.
Oh, no. I'm in Arizona. It's where I'm born and raised.
Yeah.
Can't handle the cold.
Yeah. So we did, again, in our magazine, is it in this one or in the one before that? We did a big article.
Got a lot of them.
Yeah. We did a big article on black mold and fungal exposure and how that influences the bladder.
I haven't seen that one.
Yeah. All right, hon. So anyway,
thank you so much.
Getting back to your case, the central sensitization is the landscape. Everybody's inherited it probably on one side of your family. You just got to learn to manage it. There's not a disease. It's not something that's worrying. We just have to find the life where we feel good, the life where we thrive, the life where our body thrives. And in you, that's Arizona, right? And keeping your stress levels down and keeping
around good people.
Exactly. But in the end, hon, I think you and I are twins, to be quite honest, as I am with so many of you. Oh, well, right back at you, girl. Right back at you. I want you to dive into your pelvic floor. I think that's the big missing piece for you.
Should I find someone that works with the TheraWand? Something I've heard.
Well, so the book, one of the books is really good, telling you what to do. But you have to at least work with a physical therapist once so that you understand the anatomy. This book talks a little bit more about using the wand. The wand, I don't really like the TheraWand. The wand that I
really? Do you have something else at your store? Something similar?
Oh yeah, this is the one that I use. This is actually my backup. It's the
first things I've ever bought on IC was from your store.
Yeah, IC Relief. And this is the Easy Magic wand. So there's a straight
Uh-huh.
one, there's a curved one, and then there's a longer curved one if, you know, if somebody has just needs more distance or whatever. And the advantage of this shape is that it will let you push up, right, into.
Okay.
So as I'm using it, okay, so if this is the side for me, I'm doing a lot of angling, and I'm like, I'm following my levator this way. So I'm following my levator this way, but then I'm going up. I said, guys, it's so hard to describe.
So, yeah, you're trying to stretch it, and
but you're not being aggressive. You're just following natural muscle lines. And what's interesting for me is that on a day-to-day basis, most of my pain is in my left butt cheek. It's on my left piriformis muscle, right? And so I'm pushing in on my left butt cheek. And it's a whole SI, left piriformis issue. But when I'm doing my wand, what's so interesting is it's the right side of my pelvic floor that's the one that's the most painful. So I'm laying there going, okay, I'm expecting it to be on my left side.
Like a brain thing?
No, it's just the muscle is stretched out on one side and contracted. So the muscle is, it's weird, but it's all about, there's an imbalance. So one muscle is longer and one side is longer and one is tighter. And it depends on any given time. It changes constantly. But anyway.
And when you're in a flare all tight, that can help, right?
Yeah.
Relax it after.
Yeah. Oh, definitely. And you can tell, I mean,
and what is that?
Go ahead.
What is that called exactly?
It's under physical therapy in our store. This is Easy Magic. It's called
Easy Magic.
Easy Magic. And the nice thing about it is this Pyrex, this glass, super easy to clean. You don't want to be using a plastic wand or anything like that can leave fibers. So the glass is the way to go. And it's just, I just love it. It just took me 2 years to figure out how to use it. And the only thing that helped me was reading Breaking Through Chronic Pelvic Pain, where I could really visualize as I was laying there what I was working on. You know, because when people say pelvic floor, you think, okay, it's muscles at the bottom. And you don't understand the three-dimensionality of it. And it was that book that really helped me understand where I was working and where I was touching. And so I
who's the author?
Dr. Jerome Weiss, Weiss, Weiss.
Okay.
And it's required reading. Everybody should get it, guys. Seriously. If any sign of pelvic floor issues, you got to get it. So, all right, hon, I'm going to move on. Nice talking with you.
God bless you. Thank you so much.
You've
done so much for so many of us. You have no idea. Thank you so much.
Well, you guys, if you find these helpful, please come over to our website and become a member, get our magazine.
Donate every year.
Thank you. Well, make sure you're donating to us and not the ICA, because we're the IC network.
No, IC network, and my mom and my grandma does too.
Thank you. Thank you very much.
Thank you.
All right.
Thank you. God bless, Vidi. Thank you.
You are welcome. All right. So I lost somebody. So Carol, it's going to be Carol next. And Carol, you're going to be the last one in our Zoom meeting before we go back to Facebook and YouTube. Let me try to unmute you, Carol. There you go. Hello, Carol. Can you hear me?
Can you hear me?
Yes.
I can see your lips moving, but I can't hear you. I don't know what happened.
Okay, there you go. Can you hear me?
I can hear you now. Yes.
I had accidentally muted myself. My bad. All right, hon. Are you going to turn your camera on? Or are we just going to
No, for some reason, my camera on my Mac computer is not working, so I got to take it to the shop. I tried to get and it says the camera is not working for some reason.
Okay.
And so I apologize.
Oh, you know why? No, honey, I can tell you exactly why. You have to use, that happens if I try to use Safari. But if I switch, the camera will not work through the Safari browser, but it will work through the Chrome browser.
Okay.
Okay, so
Well,
just-
I don't want to lose you, so I
That's okay.
because I've listened. This is my third time listening, so I'm relatively new to IC Network,
Okay.
and it's so wonderful listening to you. But my issue is not me. I'm here with my 24-year-old daughter, and
Oh, God
she's
bless
sitting
you.
next to me, and she's just been having problems. We've gone to a couple different doctors, you know, because she was having symptoms of what appeared to be a UTI, but initially they were coming back negative. So pretty much they just told her, they just dismissed her, basically told her to go see a neurologist or something, dismissed it. And we found a urogynecologist, took her to the urogynecologist, and she started, she did it where she catheterized her to collect the urine.
Okay.
And I just was pulling up some of her test results on the urine as we were going along. But anyway, so she's saying that my daughter has what's the name? How do you say it? Interstitial cystitis. Okay. But also along with that, PCOS. So that's one doctor that just recently told us this. But our issue, Jill, is that, as I mentioned earlier when I was on Facebook, she has that heavy feeling of like a bowling ball in her belly, and her belly's swollen. But the biggest thing is, and she's going to be a little embarrassed, but she started this bedwetting and she doesn't feel it. And it's driving her nuts, and nobody can give us answers. So she just wakes up sometimes and she's wet her bed. And of course, at 24 years old, this is making her anxiety that she already suffers from much worse.
Carol, what's your, if you don't mind, can I, if your daughter wants to use a different name, what's her?
No, it's fine. It's fine.
What can I call you, daughter? How would you like me to refer to you?
My name is Nyla.
Nyla. All right. So Nyla, the first thing I want to say to you is that this is not your fault. You have done absolutely nothing wrong. There is no shame. There is no blame. You have a real issue that deserves real care. And the challenge when you're in your teenager or in your 20s is it's very easy for doctors to dismiss you. And I don't want you to ever believe that you deserve that. You have done absolutely nothing wrong here. So
they keep nothing wrong.
Yeah, you haven't, hun. I mean, and nobody should refer you to psych or anything like that. Seriously, if this were a mental issue, you wouldn't be incontinent, and you wouldn't have some of these other symptoms. This is real. So tell me, hun, how old were you when this first began?
I was about, like, the first time it ever happened, I was 20.
You were 20. Okay. And what was happening in your life then? Were you in college? Were you working?
I was really stressed out. I was with my ex-boyfriend at the time, and that relationship was really stressful. And that's the first time that had ever happened.
Okay.
That's my story.
Okay, and hun, I never want to try to embarrass anybody, and so you can just not answer. But if, and your mom's right there, which really sucks.
Hey, Jill.
Jill,
let me tell you, we are close because
Okay.
we're very close. I go to her doctor's appointments with her because she is just really struggling.
Okay.
And everybody's kind of writing us off, and we are just, she's, Mom, can you rub my belly? It hurts so bad.
Okay.
And
So, hun, so let me ask you then, is sex painful or not?
Sometimes.
Okay. When you first started going to the OBGYN, did it hurt when they inserted the speculum to try to examine you?
Yes, it did.
Okay. Were you a dancer when you were younger?
Yes.
What kind of dance?
Here.
Say that again?
I did dance. I did jazz dance, tap dance. I did cheerleading, gymnastics.
Okay. So listen. So you have to remember, and you've already been watching me, so you already know that I've talked about how muscles can influence organs, right?
Right.
You have the perfect history for long-term chronic pelvic floor issues. You did everything you could have done that could have hurt those muscles. You did gymnastics. You did cheerleading. Okay. And the reality here is that, and Dr. Weiss talks about that in this book, that when you're a kid and you're doing it, your body is very resilient. But there comes a time when you lose some of that resilience, that the cumulative injuries start to catch up. And I have worked with dancers who they started at 10 years old, and by the time they're in their early 20s, they've got wicked muscle issues. I was working with somebody, I don't know, like a month ago, who did ballet from the time she was like 8. And she was even like semi-pro professional. And then bam, at like 21, 22, somewhere in there, all of this quote unquote IC began. So let me ask you this with respect to today. When you go to pee, can you release your urine right away, or do you sit there for 5, 10, 15 seconds before you can empty your bladder?
No, I release it right away.
Okay.
But I don't think I'm emptying it fully, because I can literally go right back in about 10, 15 minutes and go again. And at night, I never really get a good night's rest. I get up about 2-3 times a night to use the bathroom.
So have you had a pelvic floor examination?
No.
Oh, girl.
No, they have us coming in to do like a urodynamic. We've done so many tests and nobody can tell us anything.
Yeah, but
so
nobody,
we're supposed to go in for a urodynamics
I know,
test.
but Carol, but like literally any top tier IC clinic would have done a pelvic floor exam the very first appointment. You know, the fact that you haven't even had a basic pelvic floor examination with her history is almost disgraceful. So I understand why they would want to do a urodynamics, because a urodynamics basically tests your nerve function, which would help us understand why you might be incontinent. I mean, incontinence would be one of two things. It would be either a nerve injury or it would be a muscle injury. And so the urodynamics would be testing for the nerve injury, but seriously, priority number one with her history is to get those muscles checked too, immediately, like this week.
So would the urogynecologist be the person to do the pelvic floor exam?
Well, the urogynecologist would do a very quick 30-second insert finger, touch muscles. Yeah, you're tight, pull it out, send you to a pelvic floor exam. You know, it's a really good pelvic floor physical therapist who would be able to do a really thorough, hour-long, careful examination of all of the muscles influencing the pelvis. And so most of it's external. They watch you walk down a hallway. They measure your legs, see if one leg's longer than the other. They look for tension patterns in your core, in your glutes, in your leg. Like I have a lot of muscle tension in my thighs. And I wake up sometimes with my muscles very, very tight in my legs, which is interesting. But I'm a long-term pelvic floor athlete, you know, and that's just the way my body is. Then they're going to do a very gentle internal examination where they use a finger and they just touch muscle groups. They start shallow. You've got the lowest muscles, the muscles by your urethra, your levator ani muscles. They will touch those. Then they will do the mid-level muscles, and then they will go to the deeper muscles, which, you know, when I say deep, it's like 3 inches deep. I mean, it's not that far. Your pelvis is not like 2 feet deep. It's a fairly shallow area. But they're going to touch kind of the deeper muscles like the piriformis muscle. And given your history and that you were a gymnast, and this is just like critical here. What state do you live in?
We're in Florida.
Oh.
Yeah, we're just really having a hard time. And like I said, now with this bedwetting, that's just driving her nuts. I mean, it's just, she does have anxiety, but now it's just driving the anxiety through the roof.
Well, I think that urodynamics is a very, very, very good idea. And this is where something like neuromodulation would be helpful, something like the ankle stem, because that's known to, if the incontinence is being driven by funky nerves, then you can do urgent PC, which is just an acupuncture needle down by your ankle, and they put a TENS unit on it. And that would be perfectly reasonable to try in this circumstance. All the neuromodulation was originally approved because it was so good at stopping incontinence. And so that makes sense that if this is nerve driven, doing something like that is just a no-brainer here. And I'm not as up to date on what some of the other incontinence medications are. I'd be happy to help you with that. We can kind of look through stuff. But we have to deal with the physicality of this too. And the physicality of this is that there is a fundamentally a mystery to be solved as to what structure in your pelvis can be contributing to this. And you're checking every box for long-term chronic muscle injury. Generally what we see is it starts with little injury, little injury, little injury, little injury, trigger point, trigger point, trigger point, trigger point, until finally something happens, a period of high stress, a fall, Montezuma's revenge, something. There's some sort of trauma which basically turns it all on. And I really think,
Now, I was going to tell you that, you know, when this all started happening, like 4 years ago, you know, we were trying to find answers. They did some blood work, said her testosterone was high. They continued, we kept going back, trying to get answers. And they said maybe she had PCOS. Okay. So with the PCOS for treatment, they put her on the birth control pill. Okay. Now, so she's been taking the birth control pill now for the 4 years, and it's just still not really helping with anything. So when I was listening to your podcast about a week or so ago, and I heard your podcast about the 18-year-old that was having the issues with the birth control, because she, you know, she's not sexually active or anything right now. So I said, let's try going off the pill and see if it helps. So we stopped the pill a week ago after your broadcast, and just in hopes that maybe, because doctors aren't giving us anything other than test after test after test.
I know, but they've missed everything.
Antibiotic, I should say. We're not even getting tests. We're getting antibiotics. So she's just been on 3 months now of nitrofurantoin for 3 months. And they told her to take it again for another 3 months, and it doesn't help. So I said, we're not going to take it. Maybe we have to try another doctor. I don't know.
But
Jill,
here's the issue: is you've fallen down the rabbit hole of assuming bladder, infection. And if you want to know once and for all if there's infection, you have a next generation test that will tell. And so if you want to just remember, I like facts, I like data. I don't like guessing. And listen, this has been going on for 4 years now. There's way too much guessing happening. It's time for facts. And so I would immediately order this and just see what the hell they find, if anything.
Right. Well, I called, when I saw you with that a week ago, I called the doctor and I asked her, was she doing the next generation? Because she is collecting it with the catheter. And she said yes. that she is doing it next generation.
Okay.
So I just had Nyla pull up like her results from the urine culture,
Okay.
because I wasn't sure if you wanted to know what the results.
Yeah. What were they? What were the results?
Can you pull it up, back up, Nyla?
It's right here.
Okay, so when I'm reading this, if I'm understanding this, it says at the top of the page, it says results, pathogenic DNA detected.
Okay.
And then it says organism tested or detected.
Okay.
See last page for organism tested, not detected. Okay, so it says, I'm not sure how to pronounce this, but coagulase negative staph group, 10,000 to 49.
Hey, could you do me a favor?
Sure.
Oh, you can't because your camera's not working. Darn it. Can you snap a picture of it with your cell phone and text it to me so I can look at it while you're...
Yes. So, or I can just forward this whole thing to your email right now.
Yeah, forward it. Can you forward it to my email right now? icnetwork@mac.com.
Okay, I'm gonna send it to you right now. icnetwork@mac.com.
That's not my email.
Okay, I'll do that at mac.com. This one?
No, Nyla German.
But you don't have it set up, so you can't do it from that. Okay, so that's one of them. I just sent it to your email.
All right, I got it.
Let's see if I get the next one. Go to the next urine culture, sweetheart. Pull up the next urine culture.
It's asking me to sign in to an account.
Oh,
So you need to,
okay.
can you sign in, take a screenshot and send me that?
Okay, sign in, take a screenshot. Okay, yeah, we'll do that. Yeah, I am just like
I mean,
concerned.
yeah, but seriously, y'all have just completely missed the most important thing here. And I believe they haven't had a muscle assessment. I just can't, it makes me crazy.
Yeah, we haven't had a muscle. I think everybody's just giving us, like I said, her regular gynecologist just pretty much told us there was nothing wrong. They don't find anything. And
yeah, but do they know she was a dancer? Do they know she was a gymnast? Do they?
They never asked.
Right.
Jill.
Yeah.
Nobody ever asked. They basically told us, we could see a neurologist or something, but we kept trying to go back, and eventually they told us there's nothing wrong with her.
Well,
and that's why we started seeing Snapchat, sweetheart.
So I mean, there's good news in a way. So what we're saying is there's nothing wrong with your reproductive tract. So we'll take that. We'll take that as a success. But that doesn't mean that there's nothing wrong with her. What it means is that the problem is outside of her reproductive tract, which is probably her pelvic floor. And so, okay, I haven't gotten anything yet.
Okay, we're going to send it to you right now. We're going to text this over to you. So hold on. How do you want us to send this to you?
icnetwork@mac.com. See, you all have my super secret private email address. You're not going to tell anybody, right?
Select all the pages. No, go.
This is like, like how many people watch these?
I don't even have that good of a memory, so
Yeah.
I've had to shorten that down
Ditto.
really fast.
Ditto.
So no.
Here, I'll be right back. I'm waiting for that. I'll be right back.
Is Nyla's period irregular?
It was before she started taking the birth control pill. I mean, initially she had it since, how old were you when you got the first period? 12. She was about 12 when she got her months without having a period. And that's when they said they thought it was PCOS, because she went 6 months with no period.
Yeah, but sometimes
I've been told I've had PCOS because I've been on my period since June the 11th. So I was thinking it could be something hormonal, couldn't it, Jill?
Yeah, and I definitely
Could be.
think it could be something hormonal because she does have really bad anxiety. So
Yeah,
go back to that.
but you know, you know, let me ask you this question. So you both have issues. Do you both have wicked sensitive skin?
No, my issues are because I'm in menopause. She was the one that went 6 months without a period.
No,
and
I'm not
that's when they
talking
said-
about that. Let's just talk about inheritance for a moment. Carol, do you
Okay.
have really sensitive skin? Can you wear wool?
A what?
Can you wear wool?
Well, in Florida we don't. But,
Okay. Can you wear textures?
can't even stand a tag on my clothing.
Right.
So.
Okay. So, is your daughter the same way?
I don't think so.
Not really.
No.
Okay.
So that's
Well,
what
sometimes what we pass along from an inheritance standpoint is just a more sensitive nervous system. And for me, I didn't really start feeling that until my 20s when I started, I noticed the sense of smell, really wicked sense of smell. I could smell things that other people couldn't smell, sensitive taste, all that sort of stuff. Okay. Did you email me that too?
I did, and I'm sending you another one. Oh, this one says, okay, I'll send this one to you also.
So the first one didn't get through.
Oh, it didn't get through? Okay, let
No.
me try it again then.
icnetwork@mac.com, no hyphens.
No, it went through the first time. So she got it the first time.
I got the first one. I didn't get the second one that was the screenshot.
It's okay. It's in photos. Go to your photos. Now send all 5 pages. No, not like that. Choose it. There you go. That's fine.
I'm gonna do it from Gmail now.
Okay, IC Network.
At
IC
mac.com.
Network at mac.com. Just put subject Nyla.
So
Subject
for people still watching on Facebook and YouTube, I mean, this is so important that you see this diversity here. Not everybody's the same. And that's the flaw with Facebook support groups, is that you go in, you read other people's posts, you're thinking what's happening to them is going to happen to you, and it couldn't be farther from the truth. There is such diversity in this patient population. It's amazing. All right, let's see here.
It should have come through now, Jill.
Okay. Yeah, I got it right here. Interesting. So you have staph and you have enterococcus. And then it's telling you which antibiotics would be the most successful.
Is this the same one?
Huh, interesting. Coagulase negative staph. So what did the doctor say they need you to do?
They just keep giving, I mean, she's probably been on 6-7 months of antibiotics for this. And now I'm at the point where, as I said, well, maybe we can't take, because every time she takes antibiotics, she gets a rash on her neck.
So it's resistant to tetracycline, it's resistant to sulfa, it's resistant to Cipro, it's resistant to gentamicin.
They've been giving her nitrofurantoin. She's been on that for about 6 or 7 months.
Well, it does say it should be sensitive to nitrofurantoin. This is definitely, let's see. Wow, look at that. Excellent. Wow, I love this test. Holy, this is awesome. This is fantastic. What a beautiful test this is, because they're testing for everything. So they tested for bacteria, they tested for adenovirus, BK virus, HPV, herpes, JC, polyoma JC, which this is great. So negative for everything. I don't quite understand that. And they did not find any fungus. Okay, so they didn't find Candida albicans, Candida glabrata, and parapsilosis. So this is very, very cool. This is comforting. So, so for the people who had the Hunter's lesions, this is guidance UTI, Pathnostics guidance, comprehensive, persistent, complicated UTI report. They
What's the name of the test, Jill? How do you ask for a test like
ask for a next generation urine test that will test for bacteria, virus, and fungi. This is like literally the first most comprehensive test I've ever had anybody send to me. This is fabulous. So now, hold on, let me look at this. And your cytology was negative, so there's no worry about cancer, anything at all like that. That's fantastic. All right, so I'm so glad you guys had this test done. This is wonderful. So hold on a sec. Let's just do a little bit of, hold on. I'm going to go to my top secret databases here. I'm going to try to understand this a little bit more. Well, no, coagulus negative staphylococci is normally found on the skin, but they got these samples through a catheterization, correct?
Yes, she always does the catheterization. Whereas the other doctor we were seeing collected in a cup, and they were the ones that basically told us there was nothing wrong. But like I said, Jill, she walks around every day, rub my tummy, it hurts. It feels like I'm carrying a kid in my belly.
So it's normally considered harmless when it's on the outside of the body, but if it's in the bloodstream or inside the body, it's considered serious.
What's that, Jill?
This bacteria. So normally the body, that's when it's considered a bit more serious. Or did you travel at all? Was there any traveling to other countries or anything back 4 years ago?
Where were we last?
Dominican Republic.
We went to Dominican Republic, but this was when all that stuff was happening. We came home just a few days before people were dying over in Dominican Republic. U.S.
Well, I think at this point in time, you're probably going to need to work with an infectious disease doctor, an infectious disease specialist.
What are you seeing? Because nobody's told us anything.
Well, I mean, I honestly, my top secret database is I just went over to Healthline, and I'm looking at an article on coagulase negative staph infections, which is what she has, right? That's what I find.
Okay.
And so what it says is this coagulase negative staphylococci are a type of staph bacteria that commonly live on the person's skin. Doctors typically consider this bacteria harmless when it remains outside of the body. However, the bacteria can cause infections when present in large amounts or when present in the bloodstream. Doctors often divide staph bacteria into coagulase positive and coagulase negative types. Coagulase is an enzyme needed to make a blood clot. This enzyme is present in Staphylococcus aureus bacteria. Doctors typically associate this type with causing more serious infections. So Staph aureus, like MRSA, would be considered more serious than the type of infection that you apparently have. And then it describes the different types. There's epidermidis, which lives on the skin and doesn't cause infections. A person who has a condition that compromises their immune system is more likely to experience an infection of this type, such as somebody with lupus or somebody who has a foreign body implant like a prosthetic joint. It causes skin infections, but she didn't have a skin infection.
I told you, she keeps getting this rash on her neck and her chest.
Oh, that's important.
Yeah, she keeps getting this. I thought, okay, maybe it's coming from these antibiotics.
Does the rash leak? Does the rash leak?
Does it what? No, it's just really dry skin. Her skin just on the neck and on the chest. You know, it just gets really dry. So if you touch it, it feels like, I can't even describe, but it's not something you visibly see so much because her skin is brown. But if you feel it, it's really just dry, and it's I don't even know exactly how to explain it to you.
Yeah, I get it on my neck and my chest, and then sometimes I also get it under my boobs. Like it's like really shaved and cut, like it's bleeding.
I got it. Dad, did you need something? You want to come say hi real quick?
There's a lady across the street here.
I don't know. I've been doing my live stream. I don't know.
But she came out our driveway, came out for a walk. She might have run the door.
I don't know. Go check and see if she left something. You guys, that's my 97-year-old dad.
Oh, wow.
Okay, so basically what I'm seeing is that these are trickier infections. They're a little bit harder to treat. Doesn't mean it's more severe. It just means it's trickier to resolve. And so I think that you should take these results and go to an infectious disease specialist. And I think you need to show them the rash and take pictures of the rash, because one form of this does cause rashes. And then there's another form that causes bladder infections. And
really?
Yes, yeah. And you know what? Let me just, where did I find that?
See, you know what? That result that I sent to you,
yeah.
She never said anything to us about it. I just had Nyla go on the portal and pull up her urine test to send to you because I noticed that's what you had been looking at. They never mentioned it to us. They just called us and told us to take nitrofurantoin. Never anything ever said about it, what it was. I thought it was just something, people get in their urine.
No. And the irony, the irony here is if you look at the graph they sent you, the nitrofurantoin will not kill the staph. It will only kill the Enterococcus.
But now when you're looking at that, does it say that was detected, the one that you're mentioning?
Yeah.
Now, can you pull it up?
It's on the first page.
Go back to your photos.
It's on the first page.
Because I was trying to understand that when I was reading it.
No. It's right on the first page. So just go to the one that starts with guidance UTI with their name.
Okay, I see it. And where it says organism tested detected, where it says coagulase negative staph group. So it says 10,000 to 49,999. Is that what you're looking at?
Well, yes. And underneath that, go to the box underneath that.
Okay.
So the box underneath that tells you, it lists the antibiotics: amoxicillin, levofloxacin, ampicillin. The S stands for sensitive. The R stands for resistant. Okay. And so that tells you that but you have to go to the box underneath that, the little box with the 2 rows. The top row is coagulase negative, and you'll notice that there is not a check mark under nitrofurantoin. But there is the nitrofurantoin will kill the enterococcus, but not the staph. What would kill both is amoxicillin or levofloxacin.
Nyla, did she ever give you something called levofloxacin?
Mm-hmm, she did. I remember, but I feel like I just recently took that levofloxacin.
Okay, so Nyla's saying she did give her something called
I know.
levofloxacin.
So I think that the rash finding is the fact that there's a skin infection going on is really important.
Yeah, and it keeps coming and going.
That right.
I mean, it comes what, about every month.
Yeah.
It's a rash. Comes on our neck, completely covers the front and the sides of our neck.
So I think that you're well outside the bounds of what we would consider kind of a typical IC case.
Okay.
I think that muscles are potentially a huge part of this problem, but this is a very unusual internal infection with some pretty significant drug resistances, which means that it's not a simple UTI. It might be a more complex UTI, and or skin infection. And so if I were you, I think I would want to go to a dermatologist and have them look at the rash. And I would definitely maybe want to talk with an infectious disease specialist about this. Because yes, that a doctor might say, yeah, this is a normal skin bacteria. But when you look at the data, what the data says is it's not inside the body, though. It's outside of the body. If it's inside of the body, it's an issue.
Are you able to send us any information on what you just found regarding that, or?
Let me. I'm going to send you the link right now.
Okay.
I'll just reply back with the link.
And according to what you read, it could also cause bladder problems.
Well, this gives you the different species. There are different subspecies. So here, I just sent it back to you.
Right. Well, we were out of the country. When were we out of the country? Just okay. She got your email.
Okay. Well, listen, I would. We're hitting the end time for this, so I need to let the Zoom go. I need to go back to Facebook and YouTube. I would love to talk to you guys later. If you want to call this week, I'd be more than happy to talk with you a little bit more and see, see if we can dig a little bit more into it and see if we can come up with some different questions to ask. But I haven't seen that specific bacteria recently in tests because people send me their test results all the time, just out of curiosity, and that.
The weirdest thing is all of this that's happening to her all started about 4 years ago, including anxiety. So it's something happening, and the anxiety just seems to be continually getting worse. So it's definitely something happening.
Well,
I don't know what.
So I have a video on IC and anxiety on our website, and I want you guys to both watch it. And then we can talk about it afterwards. I've had anxiety since I was a kid because I grew up in an area where my neighborhood had another kid my age who became a rapist murderer, and I was one of his victims. And so I've had anxiety since I was in elementary school. And there were moments when it got better and moments when it got worse. But this class phobies that I took just gave me just 99% control over it. And I'm way better now than I was. And I wish I'd had it in my 20s, and I didn't take the class till I was like 35 or 36. So go watch that video. And again, I just need to say this. over and over and over. This is not your fault. I don't want you at 24 years of age to be carrying any shame about this, any blame about this. You didn't make any of this happen. You are hurt. And you could have you could have a pelvic injury from gymnastics and all that sort of stuff. And we won't know that until you have your pelvic floor assessment. You need to have that pelvic floor assessment. But this is an interesting infection. And the fact that you were in the Dominican Republic, could you have picked up something there? Maybe. You had the best test you could have possibly had. You had a next-gen test. I think every other doctor would have missed that. These results are spectacularly good. I'm really glad you had it done. I'm really glad you had a doctor who believed in doing it. You don't have to waste your time with fungals. You don't have to waste your time with antivirals. And so, we're just checking off boxes here. And so really it's either pelvic floor or it's this weird staph infection or the enterococcus, either or. Okay?
Okay. Thank you, Jill, very much. Thank you.
It's very hard to be in your 20s and to be going through stuff like that. I had ovarian cysts. I had mega IBS. My friends were out dating, getting married, having babies. I was at home laying in the fetal position in my bathroom for 3 years with terrible IBS, trying to figure stuff out. And I'm sorry. I'm so sorry that you're going through this, but you are a survivor. You will thrive. You will get through this. You will be stronger than ever before. You are getting insight into the complexities of life at an early age. It sucks, but the good news is this is not fatal. This is not cancer. We have to be optimistic here. You got to be positive here. There's a lot of good news here because we've ruled a lot of stuff out, and that's good. That's just only good. And
I'm so happy that you told her that, because every day she says everything's wrong with me, especially with the anxiety as well.
Well, and the anxiety really is a normal reaction to being afraid and to be in pain and to be going through other stuff. It's okay. It's okay. There's, and listen, as a mom and daughter, listen, my mom is my angel. She's 91 now. She was with me at every appointment that she could come with. She drove with me 3 hours while I was crying in the back seat of the car because I was hurting so bad. I would not be here today if I had not had my mother's love and my mother's kindness and my mother's caring. And she is the embodiment of love. She is of just wanting to try to help. And so, Nyla, as you think about your mom, just understand that she's very sincere. But there is a time and a place. Sometimes you just need to be by yourself and you need to scream, right? And that's okay too. I think. And so, give you guys give each other space. You got to give each other a little bit of distance. Practice random acts of kindness whenever possible. It doesn't need to be something that you need to talk about every day. You can do it by the roll of your eyes when you see each other. How are you, dear? You're just going to roll your eyes. That's all you need to say. It's a bad night. You don't have to dive into long conversations about it. Rather, try to focus on the positive and focus on funny things. Nyla, one of the things that I did, and this is going to sound really, really crazy, two things that I did. Somebody gave me the book, The Power of Positive Thinking, and I will tell you, it absolutely changed my life. What you see today and you hear today is all born by reading this book when I was like 30, because it gives you a roadmap. Mm-hmm. And if you focus on never getting better and you say, I'm never going to get better, I'm never going to get better, more is going to happen, you become a self-fulfilling prophecy. Because what happens is that you get more depressed and more anxious. And then what happens is your brain intensifies that pain because That's how pain is processed. When pain is accompanied by tears, the midbrain goes, uh-oh, my life may be in jeopardy, and it intensifies it to get your attention. Pain
And that's exactly what she does. That's
pain that is
exactly-
accompanied by laughter, your brain minimizes the pain. And so what the book told me to do, and here, where is it? Where is my little thing? Hold on. I got to find it in my bookcase. Where is my little thing? It's always floating around my office. Where is it? It's somewhere buried on my desk then, because I went through this with somebody else before. It's a 3x5 note cards, and it's in a spiral. So I just flip, right? And on each note card is an affirmation. And so I carried it with me. So first of all, whenever I found a quote that I really liked, I wrote it in there. Like, I can do all things through Christ who strengthens me. Mm-hmm. I can do all things. Now, it doesn't matter what your faith is. Guys, I'm a Lutheran. Yes. I'm not a born, I mean, you got to understand that my religion is very dour and it doesn't give me much of anything, to be quite honest. Right. But I can do all things through my faith, which strengthens me. And when you say that over and over and over to yourself, you start to believe it. I can do this today. I will do this today. Or another affirmation, which has been known to get me into trouble, but I don't care. Be bold, and mighty forces shall come to thy aid. Be bold. Be bold. You don't have to sit and suffer. This is about you. And this is hard when you're 24 because people want to talk down to you. But honey, you're no better and you're no worse than any doctor you see. You are a peer. You are their equal. You are a human being. Now, you might not have gone to medical school, but that doesn't give them permission to talk down to you. And I want you to up your game here. I want you to walk in so strong, so knowledgeable, so incredibly informed that you can have a really thorough discussion with them. And if they try to say, oh, hon, you're just being emotional, you're going to say, now listen, sir. You're right. This is a normal bacteria for the skin, but it's not normal when it's found inside your body. And I want you to charge yourself and empower yourself and be firm, not be insulting, not be aggressive, but be firm and be bold. It's kind of like with careers. I think one of the things that was really hard for me when I was going through all this, it was like, what am I supposed to do with my life? I can't even leave the bathroom half of the time. What do I do for a career? And I did get through grad school, which was great, but I had a lot of IBS attacks at school, but there you go. I want you to dream big. Because this is not going to change really anything. You don't have to think that you're never going to be able to have a great job. For all we know, you're going to have the best job ever. For all we know, you could be a Grammy award-winning singer or an award-winning writer or a politician or the next president of the United States, for God's sake. And you're going to pass bills on research for whatever's going on with you. Think big, dream big. The world is your oyster. It is right there in front of you. What we want to do is get you feeling better so you can go out and kick some butt and live your life and be happy. And that's what I want for you. Does that make sense?
Yes, definitely.
Be bold, my friend, and mighty forces shall come to thy aid. Every day, in every way, my life is getting better and better and better. Say it. Mean it. Believe it.
You are so in tune, Jill. It's just, I have chills just listening to you because my kid has been suffering.
I know, honey.
And I've been listening and, because of her suffering, she's just getting depressed and the anxiety. So I just thank you for those encouraging words that you just said to her because she's got a smile on her face right now. And that brings me to tears.
And Nyla, hon, did you go to college?
Yes.
And what's your degree in?
She stopped school right now because
Okay.
of the anxiety. So,
So
she's taking a break.
okay, so again, watch the video. Oh, and then you and I are going to have a whole nother conversation about anxiety later this week. Okay. And I'm going to help you. I know I can help you with that. And if there's more going on, we'll make sure that we can get you to somebody that can help you. But that video, I'm telling you, it works. Stop sign, deep breath, minimize the thought, control the adrenaline levels. You get the adrenaline levels down, everything calms down. It will make sense. Watch the video. Okay.
Thank you.
You know, and just no shame, no blame, nothing. I think that when you get more answers, you're going to change your major, and you might end up doing something that will be helpful based upon this. Sometimes I think God gives us challenges for a reason, and maybe we're supposed to do something with it. I don't know. I'm just throwing it out there. Okay.
I tell her the same thing, Jill. I'm in tears because she keeps saying, "Mom, why me? Why me, Mom?"
I know.
And I'm saying to her, "Sweetheart, God doesn't cause things to happen, but He allows certain things to happen so that maybe you'll be great in whatever you decide you want to major in." Because she's done 2 years of college, and she keeps saying, "I don't know exactly what I want to do." So she, once the anxiety came along, she just said, "I'm going to take a break because it's just overwhelming right now." So I said, "You just never know what your plans."
Okay, so Nyla, let me just say this to you. Listen, you're not going to figure it out right away. Some people do. Some people do when they're kids. They want to be a doctor. They just figure it out. They go to med school. Bam, they're a doctor by the time they're 22. That was not you. That was not me. It's about finding your joy. It's about finding something that you love so much that you can't wake up to get in the morning and go to school. Right? Yeah. And the thing is that you got to try a lot of stuff. You got to try a lot of stuff first. I mean, you just got to play in a way. And that's hard because you got to have money coming in. So you go and get the crap job if you can do it. And there's a lot of stuff you can do online, And so there's a period of time where you're going to be in a job that's obviously not going to be your career. For me, I worked in a bookstore. I worked in dress shops. I worked in a winery for 5 years in a lab. None of them were, my job. This is my job. I love what I do right now. I would never have been able to do this if I had not gone through IC and gone through this. And so, this is, you have permission to try. Go take a ceramics class. Why not? Take an art class. Take a computer programming class. Take a security class. Just go to Google University. It's free. You can watch classes from Harvard you don't even pay for. And just play. See what appeals to you. You might be a great private investigator. You might end up working for the FBI, or you might end up being a jeweler making diamond rings. You won't know until you try. And so have fun trying. And I think that I wish that somebody had said that to me when I was younger. And what did I love the most? I loved writing. I loved writing, and I loved singing. Although I wasn't that good of a singer, I was a pretty good writer. And yeah, even my family poo-pooed me, and they said, "When are you going to get a real job?" So just follow your bliss and dream big. And if you like the movies, there are movie studios in Florida. Call one. Be an intern. Be bold. Be bold. You might end up being an assistant to a famous Steven Spielberg, for all sake. I just say be bold. Okay. All right, hon. I will talk to you later.
Thank you, Jill. You're a godsend. Thank you.
Big, giant hug all the way.
Thank you.
Thank you so much.
Now I need to stop crying.
Oh, yes. Now you need to go watch funny videos. Go make some popcorn, watch something funny, and there you go. All right, I'm gonna end the Zoom meeting.
Thank you.
Hey guys, how cool is that? How cool is that? You know what? That's what being a support group leader is. It's about helping physically, mentally, and emotionally when at all possible, and it's pretty hard to do. But I don't want anybody. I felt tremendous guilt because I was sick in my 20s. I didn't understand what the hell was wrong with me. It's like, all right, wait. So I have allodynia. What the hell? Wait, now I have ovarian cyst. What the hell? Wait. I have irritable bowel syndrome. Like my first job for the feds, I was laying on the bathroom floor after eating a chocolate chip cookie and a glass of milk for hours with IBS. My male supervisor peeked his head in the door. What's wrong, Jill? Freaking IBS. And you kind of go through this point where it's like, what is wrong with me? And more importantly, what's next? Like, it's everything. It's like, okay, please tell me, I had migraines for 6 months, crazy stuff going on. And I felt ashamed. I felt like I was being punished. I felt like I was damaged goods. I felt like I was unlovable. I felt like I was a failure. I still feel like I failed in some ways because I never had children. But you know what? It was never my fault. And to be able to tell somebody else who's young that it's not their fault is so important. I don't want anybody to carry the shame that I carried. And that was from like 24 till 33 when the research came out that proved the genetic connection. It's like, oh, wait a second. My mother has this, my sister has this, my aunt has this, my grandmother has this. Are you mean to tell me this was never my fault? Oh. You have no idea how powerful that was. And it was at that moment that I let the shame go. And it was at that moment that I was allowed to be proud of who I was. And I want you to be proud of who you are too. All right, Donna, you're talking a lot. Oh, see, look, there you go. I got all worked up. What a teaching moment. So glad you hung in there. You have put your time in today. I have. All right, guys. Hey, man, it's time for some freebies. Let's do some freebies. All right. So we've got 20 people who stuck it out for almost 5 hours. Okay. I told you it's not a support group meeting if something doesn't fall. The first 5 people who send me an email with your address will get a free bottle of Allopath that I will be mailing. I've got a bunch to mail. I got a whole case here because I've already given away 25 bottles. So send your mailing address to icnetwork@mac.com. And I will send you this new Allo product that I am really, really excited about. So excited about that we're no longer going to sell the other Allo products. So I'm selling out of everything with all of Desert Harvest. I don't have that much left. And because it's been a wonderful day and you guys have been so good to me. Bam! The first person to send me an email saying they would like the book on chronic pelvic pain, I will send you a book for free. icnetwork@mac.com. I'm going to be doing a lot of mailing tomorrow. All righty? Okay, my friends, to tell you what I'm going to do, I'm going to change my clothes. I'm going to go take a walk. I'm going to make dinner. And then I'm going to watch the movie, the National Geographic movie on Paradise Burning about the fires. No, I really want to watch it because I live here and I want to be prepared. So that's what I will be doing for the rest of the evening. And we will be back again at least next Sunday, barring any weirdness like fires or my back going out like it did last week. And or I will try to do maybe a meeting this week too. Lindsay says, having a tough day, pain day today, and was nice to stumble on your live stream. Lindsay is very, very nice. And thank you so much for dropping in. And of course, if you found this helpful, please come on over to the website, the IC Network, and become a member. where you can get our wonderful magazine, the IC Optimist, which I happen to edit and write a good portion of it. And then I'm also building a whole bunch of new stuff over on our store that I think is going to be really helpful. So I'm really, really busy right now. It's pretty crazy. And if you send me an email and you don't hear from me right away, call me and leave a message, because the phones are the best way to get through to me. Okay. All right, guys. Good day. Yeah. I will see you later. All right, YouTube. See you, Donna. See you, Natalie. I haven't even started the IC awareness. You know what? Oh, hey, Donna, are you still here? I don't know if she's still here. Donna. Well, we got to do the IC Awareness Month stuff this week, too. All right, YouTube. Oh, Donna. Did you look at the graphic on the front page of the website? It was my Black Lives Matter response. What if we just use something like that for IC Awareness Month? I mean, I actually kind of like it, and I mean, it's not kind of like it. I love it. About kindness and inclusion. I don't know. The more I think about it, the more I kind of like that. But anyway, we'll do that too. So I will talk to you later, girl. All right, guys, everybody on YouTube. Bye.